All right, good afternoon. Welcome everybody, and welcome back for day 2. Those of you that were joining us yesterday, this is the Roadmap to Behavioral Health Careers in West Virginia conference. Yesterday afternoon, we heard from 3 excellent panels, and we have 3 more in store for you today. So if you happened to miss yesterday's sessions, the recording is now available on the Career Pathways video series page, and I will put that link in the chat. You can also always access the conference materials and other career pathways materials by visiting behavioralhealthworkforcewv.com. And so I'm really excited for the panels that we're going to have for you this afternoon. I want to give you one more opportunity. If you weren't here yesterday, or if you were here yesterday and you didn't win, if you post your name and your future or your current major in the chat, you can get a chance to win a door prize, which is this lovely box that you see on the picture there. If you do post your name in the chat in order to win a prize, just make sure that you watch to see if you get a message back that you won. There will be a link there for you to put your address in so that we can ship this to you. So enter to win a prize. And without any further ado, I'm going to go ahead and turn this over to our moderator for our first panel, which will be the Education and Career panel, working with adult populations. Dr. Dobish.
Thank you. Good afternoon, everybody. It's nice to see all of you, and thanks for joining us on the second day of the conference and the last day of March. So like Carolyn said, my name is Heidi Dobish. I'm an associate professor at Shepherd University, and I'm going to be the moderator for this panel. So let's begin with panel introductions. So our first panelist is Amy Bond. She's with WVU at the Office of Health Affairs. We also have Michelle Rivard, a licensed social work, community engagement and partnership coordinator at the VA. And then we have Katie Maynard, who's a licensed therapist at ProAct. So that'll be our panelists for the day, for this panel discussion. And so if any of you have any questions, most of the questions I have right now were sent in earlier by students, but I'll also be monitoring the chat. So please put some questions in the chat if you have any. So without further ado, our first question has 2 parts. The first part of the question is, what is the most important thing? Oh, wait a minute, I was supposed to introduce the panel, have you tell us a little bit about yourself. So why don't the panelists introduce themselves and let us know what their pathway was into behavioral health. Who would like to go first? Amy?
Sure. Good afternoon, I'm Amy. My pathway into behavioral health, I would say we can all agree, has lots of twists and turns. So I started out getting my undergraduate in social work from Ohio University in 2014. And then I took a detour into a master's of public administration. So I learned a lot about systems and government and budgets. And then I worked for a little while with a small nonprofit as a project manager, went back for my master's in social work and received that in 2019. I was licensed that whole time. And then I worked as a program coordinator for wellness programming with community mental health centers. Spent some time with early intervention in Ohio. I was a service coordinator, serving families with young children under age 3. And then I moved to West Virginia, and I transferred my license over, spent some time as a care manager with a large hospital system. And now I'm a researcher working with a team at West Virginia University on evaluation projects. And I get to flex my social work muscles with a bunch of PhDs and statisticians, which is really exciting. So I had a little bit of everything.
Thank you. Sounds like you have done a little bit of a jack of all trades. So Michelle, you work at the VA. You want to tell us about your pathway into behavioral health?
I would love to tell you about my pathway into the behavioral health. I kind of have a long career path, so I'm going to talk really fast to make sure I get it all in. But I wanted to start with some words of wisdom, especially for students. Please find a career that you're both good at and that you love. Find something you're passionate about. Find something that will allow you to make a difference in the world, and find a profession that you find is both secure and something that you can be proud of. So those are my words of wisdom to students who are looking for a career. Please look to find something you're both good at and that you love. My career path has been exciting. It's been diverse. I've done mostly mental health and medical social work, all ages, 8 states, did direct care, did management, did public affairs, and university teaching. So there have always been opportunities in social work to both do lateral moves when I've wanted to change to a different job title, and also to take promotions. So social work to me is a very diverse field, and it allows you to do a lot of different things. My education, got my bachelor's in social work at Shippensburg University. That was a rural program, so the focus was on rural social work. Then I went to University of Richmond, or VCU, Virginia Commonwealth University in Richmond, Virginia, and got a master's in therapeutic recreation. That was an urban setting, so the focus was on urban work. I then got my master's in social work at the University of Kansas, go Jayhawks. That was actually Midwest. So it was a Native American kind of setting. And we also worked on the strengths-based model, because at that point, Dennis Salibi, who authored all the books on that kind of social work, he was the head of social work at that point, had that position for a long time there. So it was a strengths-based program. My career, I am just gonna, before I go into that, I think it's important to get back to your career, to get back to your profession. So I did that in a couple of ways. I taught adjunct at 2 universities, both bachelor's and master's level. So that was a way I gave back to students. I have supervised people for licensure throughout my career. And that was in a bunch of different states with a bunch of different rules and regulations. And I also believe in the National Association of Social Workers. I believe in being part of that organization. Sat on that board for 5 years. And when I sat on the board, I would go to the state meetings, meet with professionals from all over the state. We'd share information, get all the new information on social work, take it back, and then run meetings in our little area. If you look at my credentials, it has that QCSW after it. That's actually the clinical certification that you can get from the National Association of Social Workers. It holds no clout when it comes to getting third-party reimbursement, but it says to people that I took the time to get 2 years of supervision to get a clinical certification through our national organization. So I have started re-adding that to my initials. Again, not important for third-party reimbursement, but important to me as a social work professional. My jobs, I'm just going to go through them like rapid pace. Started at Sheltering Arms Hospital in Richmond, Virginia. Head injury, spinal cord injury, young adults. Psychiatric Institute of Richmond in Richmond, Virginia. Freestanding Kids Psychiatric Hospital. Serenity Lodge, Chesapeake, Virginia. TRICARE Insurance, retired military families. Norfolk General Hospital, Inpatient Eating Disorders Unit, 12-step model. Tidewater Psychiatric Institute, day treatment program for adults with mental health issues. Research Mental Health Center, team leader for a geriatric outpatient mental health clinic. Foundation Behavioral Health, Kids Psychiatric Campus. We had a crisis unit, we had residential, we had day treatment, we had an alternative school. And I ran the crisis unit there and then did staff education. We had hundreds of kids on that campus. Kingwood Pines Hospital, I was a clinical director, supervised social workers in a psychiatric hospital. Worked for 2 different hospices, Hospice of the Shoals, Grace Hospice of Texas, 2 different states, Texas and Alabama. And that was supportive work with families and with patients who were going through the death and dying process. Catholic Family Services was a nonprofit agency. I was regional director, had 3 offices, flitted around from one to the other. We had outpatient individual therapy, we had adoption, and we had foster care work. I then finished my career out, or I'm at this tail end of my career at the Department of Veterans Affairs. And even here, I've gone from Huntsville, Alabama to Nashville, Tennessee, to Clarksburg, West Virginia. And I've been able to work in individual therapy, in primary care to mental health, which was actually doing mental health with the primary care docs. And now I do the CEPC position and was supervising social workers at one point. But this is a community engagement and partnership position. So I'm out in the community trying to meet the needs of veterans who may or may not be involved in the VA to reach the 11 to 17 veterans who die by suicide each day and aren't involved in a VA at the time. So that's kind of my career path. Like I said, bop, bop, bop. But I think the takeaway here is that in social work, lots of different opportunities to do lots of different things, both in direct care, in management, and also in university teaching. That's it.
Thank you. And Katie, would you like to introduce yourself?
Sure. My legal name on there is Kathleen. I go by Katie. I am the probably odd one out looking at just all of our titles. I have a master's in mental health counseling. So my bachelor's was in counseling at Marshall University, and I joke about it, but it is completely honest. At that point in my life, I chose that degree because it did not have a foreign language requirement. It's really sad that that's where I started, but I then got my master's also in mental health counseling from Marshall University, and that was due to an opportunity of a graduate assistance stipend. So they covered my master's. Initially, in all of my clinical work in undergrad and master's, I worked with children, and I realized that really was not where I felt most comfortable in working. So post master's degree, I was hired at a community behavioral health center in West Virginia, Prestare Center, as a residential and DUI instructor working with individuals with substance use disorder. And I've kind of stayed right in that realm. I first gained while I was working there the credential, the AADC, which is the Advanced Alcohol and Drug Counselor credential. And so that was supervision and testing, and really saying that I have the knowledge and skill set to work with individuals with substance use disorder. And then I worked on my LPC. That was the next thing I got, which is a licensed professional counselor. And then I moved on and got my ALPS, which is my most recent credential. And that allows me to supervise people in the counseling field to get their license to become an LPC. Places I have worked, so community behavioral health, I've worked private industries, substance use, medication assisted treatment. I have a strong background in criminal behavior and substance use, worked in Western Regional Jail and Division of Corrections, developing a new program that is about 3 years old now, called Goals, which is a 6 to 9 month residential treatment program for inmates with substance use disorders, and they have an opportunity to get a reduction in their sentence by completing that program. And left that program and came back to being just kind of a therapist, doing day-to-day therapy work, group and individual with substance use disorders in the medication assisted treatment realm. And I have stayed in this position a while, and I've actually recently taken on another part. So I'm stepping back a little bit from clinical work, not completely, and we'll be doing working with the med schools. So getting back into some research aspects and doing some research with WVU, Marshall University, and the West Virginia Osteopathic School on stigma within med students and medication assisted treatment. And also getting, there is a requirement for physicians that have to take a course to be able to prescribe medication assisted treatment. And our goal in West Virginia is that all graduates from med school at any of the schools, the three named, Marshall, WVU, and the Osteopathic School, will have completed this class. And that way we can increase the pipeline of providers that are better educated and understanding of substance use disorders. So I use my clinical work kind of 3 days a week in doing therapy, group and individual, but then I also get to support our med schools in teaching med students how to work with and understand substance use disorders, which is a big undertaking because educationally, they do not get a lot of education in substance use disorders. So.
Okay, thank you. Sounds like you are involved with making our future medical professionals as well. So our first question, like I started out saying, has two parts. the first part of the question is, what is the most important thing you've learned that they did not teach you in school? And part two is, if you could go back and give yourself advice, what would that be? What would that advice be? Who would like to go first?
I don't care to, and it'll kind of chime in teaching the medical students. So I would say, especially for me, is the substance use disorders and application of the various different therapy modules or modalities that there are that are effective in substance use and understanding. I think it was a 3-hour credit course that I took in my undergrad. And I think I retook it as part of my master's to get that credential. And so for me, the most important thing that I did not get was just that understanding and clinical application in substance use disorders. And I think if I could go back and give advice, and this is nothing against my own practice of being an LPC, but I probably would have gotten a social work degree. And I think part of that is because of the accessibility and variations of social work and where a lot of agencies will apply social work. Counseling licensed therapists, we are very limited in what we can do. And there seems to be so many wonderful job opportunities which require licensed social work. And so I would probably just double train or add the social work aspect into mine. I love what I do as a licensed professional counselor and wouldn't change that, but I would probably add in an extra piece there.
Amy, would you like to go next?
Yeah, the thing that I learned that I didn't learn in school, but I learned after I was done with school, was how to take care of myself and how to leave work at work. Which I think I'm still learning to do, and I think we all are still learning to do. In the behavioral health world, we work with people, and people are joyful and messy and hard and exciting, and it is almost impossible for us to not take home the people that we work with. And so I think that is something that in school we talked about it and it was introduced, but I didn't have a lot of practice. And so I think that's the thing I've really had to learn how to do after I was or while I was in school and after I was done with school, is leaving work at work. And the piece of advice I would give myself if I could go back was that I don't have to have it figured out yet. I think when I started as a social worker, I had a lot of ideas about what kind of social worker I would be or what area I would want to work in and the people I'd want to work with. And I am in a place that I never thought I would be, but I enjoy it immensely. And I'm thankful for all my experiences that have brought me to here. But, when I got started, I never would have thought I'd be working on research projects as a social worker. And so you don't have to have it figured out.
That's good advice. Michelle.
I think the most important thing I learned that wasn't taught in school was that what you're doing in school is building your foundation. That information is not what you're going to use once you get out into your field. That information is the foundation of what you're going to need to build and get what you need to get. But what I think the most important thing that I learned when I got out of school is that everything that you need for your actual job, you're going to learn on the job, and that you need to be a lifelong learner. That it's about going out there and Googling, it's about taking CEUs, it's about reading books, it's about growing as a professional outside of what you learned in school. That's the foundation. And if you don't have that, you don't have a foundation to build on. You have to go to school. But what you need for your job, you're going to learn on the job, and you're going to learn by doing your work outside the job. So keep growing, keep developing, and remember you're going to be a lifelong learner in the kind of professions that we're in, because it's about people and it's about life skills. So it's about day-to-day living. And that also in my career path over years has changed and evolved. And I have to keep up with what's going on today. It doesn't do any good to say what I learned 30 years ago. I have to look at what is here and now in social work today. And the advice I would give myself, what came to mind when you said that was enjoy the ride. While you're in school, enjoy where you are in school, enjoy your classes, enjoy your classmates, make some memories that you can take with you. And then when you get to jobs, remember you're there to do a job, but make some friendships. Develop your life outside of work, enjoy the ride. Don't let it stress you out, because especially when you first start out, everything's new. It's like you got your shoes on the wrong feet every day when you show up. So just enjoy the ride. Let yourself have a good time. And most of us who are sitting on these kind of things, we are the overachievers. We are the type A's. We are the anxiety people. So we're going to go into any job and do the best job we can. But what we need the help with is enjoy ourselves while we're doing it. Sit back, relax, develop relationships, and develop your life outside.
Well, thank you. That's really good advice as well. And lifelong learning, I would echo that. I would echo that too. So our second question is pretty cut and dry. Basically asks, what does a typical day look like for you? What's a typical day like? Students are wanting to know. Anybody want to volunteer?
I can jump in there. I want to go back, the typical day for my job now, because I'm doing community engagement, is not the way it would be normally. I'm all day on meetings. I work from home. So my meetings all day are on the computer, on the phone, and I build coalitions. So I go from a meeting online that has to do with the VA to being out in the community, presenting to 30 or 40 people, to coming back to my desk and doing some paperwork that I need to fill out. And the VA has lots of forms. So that's what I do now. But if we want to go back to clinical work, the last job I did was primary care to mental health integration. So I sat in an office and I had open slots every 30 minutes. So I would come in the morning. I had 30 minutes to get my day together. We had a little huddle meeting, stand-up meeting. And then it was bop, 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 bop. I would have a couple scheduled appointments, and every 30 minutes, somebody new would come through my door. And we were working with the worried well. They were primary care people. So we worked with insomnia, panic attacks, a little bit of depression, life changes, and we'd see people 4 to 6 25-minute sessions. At the VA and individual therapy, because I think this is about behavioral health, every hour on the hour, you come in, 8 to 9, you have a patient, 9 to 10, you have a patient, 11 to 12, you have a patient, 12 to 1, you have lunch, 1 to 2. So it's back-to-back patients, and they're all mental health patients. So it's see somebody for about 50 minutes, do a note, see somebody, do a note, see somebody, do a note. So that's kind of two different ways that I've done mental health social work at the VA. The primary care to mental health is nice because you're sitting there, you don't know who's going to walk through the door or what their mental health problem is going to be. The individual therapy is more the scheduled traditional 60-minute sessions with the documentation after each one.
I can also speak to a couple of clinical experiences I've had. One, I was a discharge planner, social worker at a large hospital. And that was really exciting. Every day I'd walk in, I didn't know what I was going to get into. But I was assigned a specific inpatient unit that had, I think, 34 rooms, and I shared it with a nurse. And each of us would have new assessments, so people that were admitted to the hospital, and we would go and meet them and talk about any kind of needs they might have for discharge. In those situations, I worked with folks to connect with homeless shelters, to work with home health agencies so that they'd be able to receive physical therapy when they go home. I worked a lot with physicians and nurse practitioners and physician assistants to make sure that they understood the whole needs of a patient. So the social emotional, the home person in environment. We talk a lot about that. There's a person and they exist in their environment, and so I would help medical professionals understand, hey, this guy can't come back for his follow up because he doesn't have a car. Or, hey, this person lives 3 hours away. So, can we make sure that they can follow up with a provider in their hometown? Things like that. So, that was one way that I served in a sort of clinical way. I also was a service coordinator with early intervention in Ohio, which in West Virginia is called Birth to Three. Fabulous program, has a special place in my heart. And I got to meet with families in their homes, which home based work is so special to me also. Got to meet with caregivers and parents and families and talk to them about their child or children. And we got to make service plans and set goals based on developmental areas that the child was presenting with different needs. And I got to integrate different professionals into that family service plan. So we got to work with occupational therapists, speech therapists, and I would have time with those families to talk about what's important to you. What do you want to, add to your day so that your child can grow in these ways or meet these needs. So yes, Birth to Three is a very special program to me. I'm a huge supporter of it.
And then I guess, so I also have a two-sided, I've done supervision, administrative work, and then I've also done the clinical. And now my job has two different frames to it. So a clinical day, I could do anywhere from, I'd probably say 8 or 9 individuals. We do our individuals here in 30-minute blocks, and it just finds our patients do much better in 30-minute timeframes than 60 minutes. The attention span is much more difficult in a 60 minutes. So we meet with them several times throughout a month instead of one big hour. And so I'll have several individuals, and then we also conduct group therapy. Substance use disorders group therapy is really still a preferred modality of services. So I can do anywhere from 1 to 2 groups in this setting. When I worked residential, they were much longer. They were 1.5 and 3-hour time blocks of group therapy. And with every intervention or interaction with the patient comes documentation. So there is that piece. I know Michelle spoke on that, and how each person achieves that is different. Mine, some of it's done with the patient present and some of it's done after they leave. Staff meetings with our doctors, where I work now, we have a very open door policy with our physicians, and we staff a lot ongoing conversation of how a individual is doing in their recovery, or what are some barriers, some issues we have. Communication with our peer recovery coaches, lots of case staffing and organizing and treating our patients as a whole. So it is I always say, I wear my tennis shoes on my days that I'm in clinic, because it is busy from 8 a.m. until 4:30. And so example, today I have, this hour is my hour free. And then I think I've got another 30-minute block at the end of the day. But other than that, I've been with patients, which is why I like to keep my foot still in the clinical realm, is because that our patients teach me so much about community resources, about substance use disorders, life problems, so many things. So I always will want to keep a toe in the clinical realm. So.
All right, thank you. You all described some pretty busy, hectic days. So this was a popular theme among many of the questions from students, and Michelle touched on this a little bit, but how do you include self-care into your daily routine?
I would love to talk about this. Self-care is very important. Like I said, I think we're all still learning our favorite ways. And even as you become a professional and are a behavioral health professional, the ways you take care of yourself will change. Um, so I think my favorite ways for self-care right now, recently my husband and I purchased our first house, and I've been taking out my stress on all of our house projects, which also tend to create stress, but it's a different kind of stress. I think having moments in your day to kind of check in and check out is one of my favorite experiences. So when I get ready to start the day, I have a routine of what I like to do to kind of check in and say, okay, now I'm at work, and put my work brain on, leave home at home, I'm at work. And then at the end of the day, I like to, it's funny, but I like to do like stretches with my neck and my shoulders. And it's like my check out of the day. So I like to say, okay, I'm leaving work here. I'm not going to take this home. The things that I worked on today are where they are. And tomorrow I will come back, or Monday I will come back, and I will work on them then. And so it's a lot of, it feels kind of, I don't know, hippy dippy, but it is very helpful to have physical reminders to say, I'm checking into work, I'm checking out of work.
Thank you.
I don't care to chime in on this one either. It's mine's really simple. I love working out and running, and so that is my mental like break. It's really good when I'm in an activity, running or whatever. I don't focus on all these things, these projects that I'm involved in professionally and personally. I'm able to kind of just let my mind go and listen to music and try not to pass out and fall over. And so it does work really well. It's a good, just allows my mind to wander. And then I also am involved as a volunteer professional and as a bereaved parent in a support group for bereaved parents of a certain genetic disease. And so that is a lot of important self-care for me, is being involved with them. And I get to put on my professional brain some, as I'm the bereavement coordinator. And so, providing support to bereaved families, but then I also get to experience that as a bereaved parent. And so being involved in that organization is another self-care for me, professionally and personally. But I think that it all goes together, is finding the connection with people, and I'm involved in other community things. And some of my community involvement here locally, I get to wear both brains. Not only do I get to, or both hat, I not only am professional, but it's also personal. And that's kind of a self-care also. It's kind of a little bit of work, but a little bit of, what I like to do and my hobbies. So, but for me, my primary one is working out. And so I love it. And it's my space.
Thank you. Michelle, do you have any?
Yeah, I think that you have to look at your world you have to split it into your 3 8-hour segments. And I think number one, you have to sleep 8 hours a day. And I think it's really important for everybody to look at their life in terms of 3 8-hour segments that they're passionate about and that they give their all to. If you don't sleep, you're not going to be any good for yourself or for your work. And I think it's important at work to give your all and to spend that 8 hours giving it. And then make sure that you take your lunch break and take it away from your desk, away from your computer, away. And then the third 8 hours, I think it's really important for you to be passionate about something. You have to have energy left over. You also have to balance that energy. I put 1/3 of my effort into sleep, 1/3 into work, and 1/3 into myself. And it doesn't matter what my ways are of taking care of myself, but I always start, when I give talks, I talk about my own life, and I start my day. I gotta, have my meditation time in the morning. I have to have my exercise time in the morning. I go to work, and then I've got my horse, I've got my dogs, I've got my family. But I just think it's important for everybody to always break themselves up into those 3 8-hour segments, and to think about giving 1/3 of their energy into each one, rather than something being out of balance with it from the other one.
Right. Thank you. So our next question is on a different focus, but this question is, what is the biggest obstacle you have had to overcome in order to provide services to your client? Your biggest obstacle, or obstacles, there's more than one. Who would like to go for that one?
I think that there's always going to be obstacles. I think the obstacles change in every setting, but I think the biggest obstacle can be yourself, because you have to advocate as a social worker or as a mental health professional. You have to advocate for your patients or your clients or whatever it is you call them. And that sometimes gives you a frowny face to the administration where you work, or your boss, or other people. But it's not always the most popular vote to advocate for your clients. So I think I can be my own worst obstacle when I stop thinking about what my client needs and how to advocate for it, and start worrying or be too sensitive to what's administration saying about that. Not that I don't want to keep my job, and not that I don't want to do a good job, but sometimes you have to be a squeaky wheel when you're trying to get what your clients need in your agency and outside in a very professional, polite, pleasant, and cooperative way. That's it. That's all I got.
Thanks. Does anybody else have anything they want to offer?
I think mine is kind of in the clinical way. I'm thinking, biggest obstacle is sometimes I do agree with Michelle, like us being an obstacle, and then also the patient's willingness and readiness, and some of that, it feels like such an obstacle, especially working in substance use disorder. And sometimes extending on again what Michelle said is identifying what success is. What success for one patient may not be what success is for another patient, but an obstacle is whoever they is, the insurance company or administration or the grant or whomever, identifying what is success. In substance use, it may be harm reduction for an individual. They may not be ready to completely stop using substances. So we're looking at harm reduction. Ultimately, as one of our doctors calls the home run is when they're returning to a healthy level of functioning. They're working, they have custody of their children. They are gaining those independence and higher functioning, but sometimes we don't know what success is. And so that can be an obstacle or a barrier in us achieving goals, treatment goals. And so I say it's us, it's the patient, and it's whomever, whatever we're looking at, what is success can be, not having a clear definition.
Okay. The next question talks about ethics. So can any of you give an example of an ethical situation where you were unsure of what to do, and what did you do?
I think I know I can speak. This is common, and I think it's important to address in West Virginia is dual relationships and small community, rural community. I am not from West Virginia and am a transplant, but in this area, my husband knows a lot of people and is related to a lot of people. We have a common last name. And so there is a lot of dual relationships that we have to navigate. And I have to make sure that if there's one and it's unavoidable, when I taught DUI services in the state of West Virginia, sometimes it was unavoidable. We were the only program within several hours. And so they had to come to our program. I had to be the instructor. And so making sure that in that ethical situation, it was very clear my role, their role, and our supervisors were aware of the issue, and it was documented. But dual relationships is it's in West Virginia, it's going to happen. It's common, and making sure that you are as ethically sound and that you are staffing with supervisors and things are documented is essential. I know even in my supervisees, we talk about that, make sure that things are documented, but dual relationships is a common ethical issue. And so, making sure it's addressed, it's aware. We don't have another provider in the area if that was an issue to provide that service. In a lot of ideal cases, I would pass the case on to someone else to manage it. Like when I worked in the jail, I was the only therapist in the jail. So there was no referring to anybody else. And so sometimes I had to draw those barriers and say, no, I'm not eligible to work with that person, and notify people, and we would figure things out. So, but dual relationships is a common one.
I think to kind of piggyback too off what Katie said about dual relationships, I wanted to kind of go more global with it, which is what I tell students and people that I supervise for licensure. You can always get a new job, you can't get a new license. That once you lose your license, it's over. So you need to know your own code of ethics, and you need to know what your professional standards are for your licensure. And as you were talking, Katie, it brought to mind the one thing that the social work code of ethics says, is that you can never have a relationship lifetime with anybody that you've treated as a client. So it's just something you have to keep in the back of your mind, that if you're going to enter into a relationship, a social, a romantic relationship with somebody, you just need to keep that in mind. How are you going to justify that to the board if it gets questioned? So that's my advice, or my input is always that the situations are always going to come up because your agency and your institution is looking at keeping the institution alive and keeping the agency going. And that's really important because you want to have a job. But you need to, again, find ways, and I go back to polite, pleasant, cooperative, and professional. Polite, pleasant, cooperative, and professional ways to make sure that if someone asks you to do something that's not ethical, that you point out to them in a factual way what your code of ethics says and what you're bound to by your licensure structure, so that you don't lose your license. You cannot. You work for 4 years of school, 6 years of school, all that supervision, and one ethical sidestep can put you in a position where you can't work in that profession ever again. That's my input.
Amy, do you have any on that?
I think it kind of goes with what Katie and Michelle are describing, just confidentiality in general. So I think it goes a lot with our dual relationship idea, protecting your license and knowing your code of ethics. When we work in small communities, when we work in the communities that we've grown up in, confidentiality becomes really tricky sometimes. I think hallways and break rooms and restrooms can become a really difficult place to protect your client or your consumer's confidentiality. I think that with the plethora of electronic and digital communication platforms that we have access to, confidentiality can get really sticky. Um, because at the end of the day, as behavioral health professionals, regardless of what sector that is, as a counselor, as a social worker, as another kind of professional, an addictions professional, whoever you are, your job is to protect the people that you serve. And you are serving them, right? So we're serving the folks that we work with, and our job is to protect them because the rest of the world might not be protecting them. And so I think that maintaining client confidentiality is something really ethically important to me, that it regularly is challenged, and there are opportunities to like Michelle said, sidestep or just trip and fall. There are plenty of opportunities to trip and fall when it comes to confidentiality.
Well, keep it in that line of thinking about licensure and what you go through to get your license. This next question says, if I'm interested in pursuing an advanced licensure, like in a licensed social worker, how does one go about finding a supervisor if there is not one in your current position? How do you navigate the conversation of asking someone to be your supervisor?
This is a fantastic question because I had to do it. It's very difficult. I will say a lot of the larger, more traditional agencies where a lot of us behavioral health folks live and work have this system kind of built in already. And so hopefully a lot of folks on this call won't have to navigate this. But it is difficult. It's difficult to find a supervisor who jives with you, who has a supervision style that you work well under. Um, but I think that the situation that I navigated, which I hope, like I said, I hope all of y'all can just find supervisors where you are. But the situation I navigated was to reach out to other community agencies. I was with a very, very small group, and so there wasn't a social work supervisor ahead of me in that agency. And so I had to reach out to other community agencies by email and telephone and almost kind of sell myself, and say, hi, I really want to work towards, professional licensure. I need a supervisor. And I had to navigate uh, just meeting people. It was difficult. Um, Once I got to explain myself a little bit, of course, as Michelle said, so many of these behavioral health professionals are looking to give back, are looking to serve the ones that are coming up next. And so everything worked out. It was fine, but it just was stressful. It wasn't scary. It wasn't something that I'm regret. I'm glad I got to grow and learn how to do that. But it was like selling myself a little bit, which was weird.
I agree with what Amy says, that it feels stressful when you have to go out and ask somebody. But I can tell you from the flip side that it's always a compliment when someone does ask you. That they somehow heard about you in the community, you somehow came to their attention. And whether they choose you to supervise them or not, whether it works out or not, I think if you're a student looking for that person on the outside, don't ever be afraid to approach anybody, because I can't imagine anybody not seeing that as something that's a compliment to them when somebody asks. And I think as a student or as someone seeking the upper level licensure, if somebody's not working out, just pick a new supervisor. You are not married to that person for life. You do a year, a half a year with them. It's not working out either because logistically you can't get to them. The style doesn't work. They're not giving you what you need. That's not a reflection on me either as the supervisor. If it's not working out, it just means that my style or what I have to offer may not fit with what they need. So, yeah, and I think you can, I don't know of any state where you can't go to, you Google that state's board, that licensure, and it usually will allow you to pull up all the people who have that level of licensure in that state. I mean, I've lived in 8 states, so I've been licensed in a bunch of them. So I don't think I've ever lived in a state where you didn't have access to that list, or if you called them. I think most states kind of keep a list where they can give you some direction and guidance on where to find somebody. But yeah, usually the licensing boards, once you can get somebody on the phone, because a lot of them don't work full time or they're doing different stuff. So I think the licensing boards too sometimes can be helpful, or the list that you can find on their servers can be helpful.
Katie, do you have anything you want to add?
I don't think so. I think that question, you had said it was social workers, which the LPC I do know is we get to our LPC slightly different than social workers. So you test first with an LPC and then go through 2 years of supervision or 2,400 hours of supervision. But I think it is, a lot of the agencies will have somebody built in, and then most agencies are willing to even reimburse. There are sometimes fees associated with supervision. And I know some of it is just strictly to cover cost of insurance for the supervision and things like that, and to reimburse for the time. And so it's just finding that match and changing. I know due to my different work situations, my ALPS changed several different times because of my position. I was working at one agency and then I went to a different one and they were no longer able to supervise me. And, and by the end I'd had 2 supervisors when I was working at the jail just to ensure I was getting enough of my hours. And so it's a fluid process and you want to make sure that it is something that you're comfortable with and that you're growing so that you can gain those skill sets that you need to be able to effectively do your job.
Okay. So here's another question on practicality about how jobs are going. How do you think professionals should think about salary in light of the pandemic? And is the demand great enough that it's going up, salaries are going up? Or are resources as thin as ever and we should expect a lower salary? What do you think about that question?
I can tell you, substance use disorders, when I started 11 years ago, I think I made half of what I make now. So salaries are gaining, I think, through legislature and the need in substance use disorder. There is more funding coming our way. and it's going to be, I have been paid one end of the spectrum to the other end. I'm thankful where I'm at now. We are paid very well for the services we do. And on the self-care piece, we have a very good benefit package that supports us taking self-care, which has not been true in all of the agencies I have worked at. And so, I think that our pay is, as therapists, social workers continue to justify our field, that things are going to be reimbursed effectively. The fee, we are saturated. We don't have enough therapists and social workers. I've never worked anywhere that was fully staffed and stayed that way for a long term, because there is so many different employment opportunities and places to go. So there is a need. And I think agencies now are understanding in order to be competitive and hold on to people, they're going to have to pay us well for the work that we're doing. And I'm thankful the location I'm at now, we are treated very well in that manner. And we're able to use our benefits and can work and enjoy our life and enjoy the pay that we get, because I've not always worked places that way.
My comment on that is to write down usajobs.gov. I have worked for a lot of agencies in different states. I've worked nonprofit, I've worked for profit, I've worked community, I've worked hospital. And I can tell you that I decided to end my career with the government. I've only been with them 5 years. But if you can get 20 years in with the government, you have a pension, which is unheard of in today. You can carry your health insurance with you into retirement, which is unheard of in today. You can retire in 20 years with retirement, which means if you start at 25, you're 45 and retiring and can do a second career. And I do feel like, having done, like I said, a lot of different jobs, the government jobs you're well paid and you're expected to work 8 hours a day and no more, basically. So to me, it's a good fit. The work is very different. And I could go more into detail with that personally with anybody who wants to talk about the pros and cons of the government, but really to start with the government at a young age is not a bad way to go. And if you want to move around and move up, I mean, for me, I've got available to me international. Every time I look on USA Jobs, I could go to Guam tomorrow. I could go to Puerto Rico. I could go work in Germany. I can work in Alaska. I can work in Hawaii. I can work anywhere in the United States, and it's a transfer. I don't lose benefits. I don't lose time. I start out with a lot of vacation time, a lot of sick leave, and it builds, in 5 years and then 10 years. So, I'm plugging what I do, but it's really, if you're a student or you're looking for a profession, it's a good thing to look into, because the jobs are very secure and very well paid.
To add to the conversation about benefits and salary, I think it's a very timely question. So good job, whoever submitted this question. I think that in our state and in our country, behavioral health professionals are getting a lot of the light that they should have gotten 20 years ago, 50 years ago. I've only been out of school as a practicing behavioral health professional for maybe 7 years-ish. And I have seen this change in our culture and in the hiring practices and benefits and salaries that are reflected in agencies. I think a lot is happening in our state right now with this topic. I would encourage you all to go and read about what just happened in the legislative session that just ended. I think whoever submitted this question already has the gears turning to make themselves a really good behavioral health professional, and to ask these questions when you go to job interviews, when you apply for things, when you're looking at your path in front of you, because there's a lot happening in this world related exactly to this. It's also a really big decision point for people, as Michelle said, like having security, having salary that you can count on, having benefits like Katie talked about that allow you to enjoy your life. those are important decisions when you're thinking about who do I want to be? What kind of professional will I be? This is all part of that.
Yeah, thank you. We have 3 minutes left, or about 3 minutes. So I don't know if all three of you can touch on this or answer this question, but we touched on it briefly in one of the comments from before. Do any of you have any experience with international social work? If not, do you have any advice on how to find out more about the opportunities within the area of social work?
usajobs.gov. If you put social work in that little search bar, it will pull up social work jobs, and especially if you put in different countries. But it does allow you to see where the jobs are and what's out there. And a lot of times with the government, the international jobs, to me, are easier to get because there's less people applying for them. I don't want to leave the country right now and leave the life I have here, but and I don't know how. The other thing is adoption work that I did at one of my jobs. There's a lot of international adoption agencies, and you may work in the United States, but you may get to go to the countries where a lot of your children are going to be that are being adopted out. So that's another field where I think international work naturally flows into what you're doing. Because a lot of our babies were not coming from the United States. Well, most of our babies are not coming from the United States.
Anybody else have any thoughts? Okay. Well, I think thank you so much. Thank you very much. You did great. There were great questions and really good answers. And I hope people the members here got their questions answered as well. So I'm going to turn it back over to Carolyn, and thank you all very much.
Thank you. Big thank you to the panelists and also to Dr. Dobish for sharing the questions that were submitted by students. Just really, really good information. I was thinking about it while I was listening to the three of you, probably decades of experience that we just heard from. And so just really good to hear your tips for people considering this field and this pathway. So we're just going to keep on rolling. I mentioned yesterday, we're not going to take a lot of breaks during the conference today because we have 3 panels back to back. But of course, if you need to stand up and stretch or take a break, go get a drink of water, please feel free to do that at any point and then come back. The sessions are being recorded and posted so that people can access them after. But we're going to move right on into our next panel. I'm really excited to be able to share with you what we have coming up next. This is what we are calling, How Do I Get There From Here? This panel was formed in response to questions that we received from students around, okay, maybe I'm interested in something in behavioral health or mental health or social work or counseling, but maybe you're coming at it as a high school student and you're not sure what it looks like to apply for college and apply for scholarships. Maybe you're coming at it as an undergraduate student. You're not sure what graduate program you need to pursue, or maybe you're finishing up a graduate degree and you're looking at what salary you're going to make and the amount of loans that you're going to have to pay back. So that's how this session has been designed, to answer some of those questions and to provide information to you. It is jam-packed. We have 5 different speakers who are going to be talking to you about the information that's on the screen there. And so I'm going to go ahead and introduce our first speaker, and then we'll just roll right into our subsequent speakers after Michelle speaks. So first up, we have Michelle Yadrick. She's a supervised psychologist in the Master of Arts in Clinical Psychology program at West Liberty University. She obtained her Bachelor's of Science in Psychology from West Liberty in 2018. And along with psychology, her passions include teaching, poetry, and spending time with her cats. So Michelle is a current student. I think, and Michelle, you can let us know, but I think graduating this spring from
Yes.
West Liberty. And then after her will be Tana. Tana is the financial aid manager for the Division of Financial Aid at West Virginia Higher Education Policy Commission, where she's worked since 2009. She began as an education outreach counselor after getting her bachelor's in psychology from WVU. She went on to get a master's of public administration with a specialization in healthcare administration and has worked in various roles at Higher Education Policy Commission. After Tana, we will have 3 very quick presentations, one from Stephen Little, who's this project coordinator for the statewide therapist loan repayment program at DHHR's Bureau for Behavioral Health. Then we'll have Michelle Rupert, the program administrator in the Division of Health Sciences at the Higher Education Policy Commission. And finally, we'll have Heather Tolley, who's a nurse and the director of the National Health Service Corps, coordinator at the Department of Health and Human Resources, Bureau for Public Health's Division of Primary Care. That is quite a mouthful. So I'm going to go ahead and turn it over to Michelle. And Michelle, if you want to just let me know when to advance your slides, it's up to you.
Okay, thank you so much. Hopefully everybody can hear me and see me okay. At some point you might also hear and see my cat, so I apologize. As she said, my name is Michelle Yadrick. I'm going to talk first about the need for mental health professionals in our state. So if you could please advance the slide. Thank you. So what stuck out to me were a few statistics. The first, of course, being how prevalent serious thoughts of suicide are in our state. It's higher than the national average. Additionally, we also have an opioid crisis going on. You may have heard of that before. And 70% of our overdose deaths in 2018 were by opioids. I work primarily right now with individuals with substance use disorder, including opioid use disorder and alcohol use disorder. It's very rewarding work. It's very difficult work. This has a very strong grasp on the citizens of our state. One thing that also stuck out to me was that over half of West Virginians with behavioral health issues or mental health issues did not get treatment in 2019. And because of COVID, this statistic has likely actually gone up. There's entire areas of our state without access to mental health services. So if you think of like maybe further downstate, depending on where you are, there's a lot of land and a lot of forest and a lot of mountains, and there's not really a lot of agencies. So commutes, down twisty roads are very difficult for people, especially without adequate transportation. So basically the more the merrier. We need mental health professionals in our state. You can go ahead and advance the slide. I'd like to tell a little bit more about what different kinds of mental health professionals there are. There are counselors, social workers, psychologists, substance use counselors, psychiatric nurses, and mental health nurse practitioners who are able to prescribe. PAs in mental health, psychiatrists are able to prescribe, they're doctors. Peer support specialists, so this would be if you do have experience in addiction recovery yourself, you could become a peer support specialist certified in our state, and individuals working in prevention and outreach. So there's a lot of different opportunities here. So you can advance the slide, please. Thank you. These are pictures of my journey personally. I don't have the mustache anymore. So I did go to West Liberty University for my bachelor's and for my master's. And in the bottom left corner, that is me teaching. So once I graduate with my master's, I'm going to do part-time teaching and part-time working with patients. So I'm very excited to do that. I just kind of wanted to give a little example of how I made it through 2 programs. And what I did, you can advance the slide, is I went for my undergrad. What an undergrad degree in a mental health field such as social work or psychology involves is basically passing classes, learning more about your field, doing practica, which would be jobs through your program. So if you're going into social work, psychology, or counseling at the undergrad level, you'll be able to work through your program to get a position, like maybe a semester-long job or a 2-semester-long job, and get hands-on experience doing what you're going to end up doing. in our field in psychology, we have a major field test. So you can pass that and just make sure that you kind of have a summary of the content of what you learned. And then you can go ahead and move the slide forward. I'll tell you a little bit about graduate school. Graduate school is pretty much necessary if you would like to go into the field of counseling or psychology. Social work, you can begin at the bachelor's level. So that's something that's important to remember. At the graduate level, it still involves passing classes. I had an on-site practicum at my university. So I was able to work with patients at my university clinic. After that, you get to go to an external agency and work somewhere, anywhere that has a position open. So I am currently doing my internship at Northwood Health Systems and studying for my licensure exam. I chimed in a little bit early. I heard one of the speakers mention about licensure. That is basically how you prove that you're able to work with people. You pass a licensure exam and you get a card that says that, you're good to go. I will be working on that exam pretty soon here and talking to the state licensing board. After that, I will be making sure that I get supervision hours. So like social work, I heard that somebody mentioned earlier, like social work, you need a supervisor for psychology and for counseling so that they can give you feedback on how you work with people and so that you can learn. So you can go ahead and advance the slide, please. Thank you. This is from the West Virginia Higher Education Policy Commission's website. Very useful website. Please check it out. This talks about what colleges and universities offer which programs. So for example, at a social work degree, you could get a bachelor's degree or a master's degree, and it lists the programs in colleges that have that available. In counseling, there's 2 universities in our state that have a master's degree in counseling. So that would be Marshall University and WVU. And in psychology, to become a licensed psychologist, you'll need a master's degree or a doctorate degree. West Virginia is one of 2 states in the country that allows you to get licensed as a psychologist at the master's level. So that's something really great. The other state is Vermont. So at the master's level, you can become a licensed psychologist. And programs include Marshall University, West Liberty, and WVU. If you want to get a doctorate, you could look at Marshall or WVU. So those are some examples of how our state, has programs already. The usual difference between the fields is that social work has a lot of direct work with patients in lives of those in need. So it's not always necessarily your patient or your client, but it could be somebody that you're doing case management with, helping them get to appointments, helping them get the resources that they need at home. Counseling works with people who basically just need some guidance. You need to solve issues with life transitions, going through depression, anxiety, trauma, divorce. And this allows you to be at agencies or working independently. Usually, social workers at the bachelor's level will work with an agency, and social workers at a higher level can work independently, like counseling and psychology. Psychology, that's a field that involves psychotherapy for treatment of mental disorders. So that could be anywhere from generalized anxiety disorder to schizophrenia. I work a lot with people who have schizophrenia or psychotic spectrum disorders. It's very rewarding work. So you can go ahead and advance the slide. So these are some steps that you can take if you're interested in social work. At the high school level, you'll want to look into taking dual credit courses or advanced placement courses in psychology, actually. So you'll notice that all 3 of these fields, social work, counseling, and psychology, it's a good idea to take advanced courses in psychology if this is something you're really passionate about, because those those classes will count towards your college degree. It's always important to volunteer and talk to your school counselor and learn about diverse life experiences. At the college level, you'll want to talk to your advisor actively. So not just when you need to, get your course registration going, but actually figuring out, what jobs are available, what placements might be available for me. Staying active in your coursework and building professional relationships in time for your practicum and your internship. At the graduate level, this one is pretty, I think it's great. All of West Virginia's Masters of Social Work programs are accredited through the CSWE. So I was going to say, watch out, make sure it's accredited, but all of our schools in our state have MSW programs that are accredited. You'll also get an internship there and take a licensure exam. So I'm going to talk about counseling next. It's pretty much the same at the high school level. Make sure that you're talking to your school counselor about your next steps for what colleges might be interesting to you. If you want one close by or maybe a little further away, what programs are interesting to you. Once you're in a college program, maintain your coursework and talk to your advisor. Getting letters of recommendation is one thing that you'll see across all three fields as well. So it's very nice to kind of build relationships with your teachers and instructors. They know your skills, they know your weaknesses too, and having a really strong professional relationship is going to be important so that they can support you. If you're going into graduate school for counseling, that would be a master's level. And so it's important to know that transition between undergraduate, like regular college, and graduate school. So like a master's degree for counseling and for psychology. You'll look for a supervisor, prepare for your licensing exam. If you're interested in counseling, you could visit www.counseling.org. And last but not least is psychology. Once again, it's good to take AP courses if you do have time for that in your high school, or if you do have that available at your high school. It's always a good idea to get a little bit of a one-up or get ahead so that you have some credit already accrued when you go into your college program. And at the college level, getting practica and internships, that can be fun. I will say it could be a little bit stressful looking for these no matter which field you choose. So having a strong relationship with your classmates and having a strong relationship with your instructors will help you find places in the community and in the state really that can get you a good internship placement. At least a master's degree is needed for psychology, like counseling in the state of West Virginia. And if you want to go further and be able to practice outside of state lines, you'll need a doctoral level degree. So obtain an approved internship. Approved internship just basically means that they know it's a legitimate agency and that you can get your licensure experience there and count your hours in supervision. So you get hours in supervision by basically meeting with your supervisor, talking about your cases and getting feedback on them. And that counts for supervision time that you'll need to get licensed. And last but not least, you'll need to pass the licensure exam. For psychology, our licensure exam is called the EPPP. So that's just a fun fact. You can look that up if you're really interested in psychology. I think that this quote pretty much sums up what inspired me to work in the mental health field, especially in our state, which has a lot of need. If you find it in your heart to care for somebody else, you will have succeeded. This is a beautiful quote by Maya Angelou. And I think that knowing, how much our state needs these services can really motivate, if you want to help people, it can motivate you to help people right here at home. Thank you.
Okay. Hi, everyone. My name is Tana, as Carolyn introduced me at the beginning, and I work with the Higher Ed Policy Commission, and I've been here for a while, and I'm going to talk a bit about financial aid. So why do we need financial aid? Who applies for financial aid? The who, what, when, and where? We're going to go over all of that, and I'm going to speak quickly because we have a lot to get through. So who applies for financial aid? Any student who is planning to attend post-secondary education or even considering post-secondary education, whether that be at a certificate level, associate degree, bachelor's degree, master's degree, you need to apply for financial aid. Next slide. Why do you need financial aid? This will help you pay for the costs. So there is usually a cost associated with any type of post-secondary education, and sometimes it's very expensive. So the more financial aid you have to help offset that cost or to help cover it fully, the better. And you'll be more likely to succeed when you go to college if you have this financial aid to help you pay for it. Next slide. So when we say financial aid, what are we referring to? So it is any funds that are used to help pay for post-secondary education. And that can be at the federal level. So the federal financial aid that's overseen by the federal government, state financial aid, which is what our office oversees. So we're a state agency and we oversee the state's financial aid programs for West Virginia. There's also scholarships, which can be merit-based or performance-based, as well as grant programs, which are need-based programs that you don't have to pay back. You wouldn't have to pay back scholarships either. Loans are given, which you do have to pay back, usually with interest rates, as well as institutional aid. So institutions have lots of different financial aid that can help you pay for college. And we're going to dive into these a lot more. So you can advance the slide. So when do I need to apply for financial aid? So typically you're going to be applying the year before you plan to go to school. So next year will be the 2022-23 academic year. And that is when you would be applying for financial aid. But all programs are different and they will have different deadlines. So you do want to research this information, try to find financial aid programs to apply for. Know if you need to apply for them annually. Most of the time you do have to apply for it each year. And then some of them also have renewal requirements. So you're required to meet certain academic requirements for you to maintain your eligibility for whatever the financial aid program is. Next slide. So where do you apply? It really just depends on the program. Usually you can apply online, and that's how most of the applications are going to be formatted. But there are some that you still may be required to mail in an application or mail in additional information. So just make sure whatever program you're applying for, that you're following the directions. They may require you to submit additional documentation like a transcript. So make sure you're sending it in the format that they've asked you to and to the place that they've asked you to, because if these documents get lost, sometimes it can either delay your eligibility for financial aid, or it can cause you to not qualify for certain financial aid that you could have qualified for otherwise. And again, I cannot emphasize enough to beware of the deadlines, because if you have a deadline and you miss it, sometimes that means that you are out those funds. Once they're gone, they're gone. So just be aware and put those reminders on your calendar to reapply. So financial aid applications, the most important financial aid application, can you go back one? I think we went too far. Okay, thank you. So the most important application would be the FAFSA, the Free Application for Federal Student Aid. That is the federal application that you would fill out to see if you qualify for federal financial aid and some state financial aid programs. And then other state financial aid programs like the Promise Scholarship and the West Virginia Invest application have additional requirements, like you have to fill out an application online for the Promise Scholarship and for the West Virginia Invest grant. There's also institutional applications. So if you're applying for institutional aid, you'd likely have to fill out an application there, as well as private scholarship applications. Okay, now we can move forward. We're going to talk a little bit about the FAFSA. So the FAFSA is available at fafsa.gov on the Federal Student Aid website. So it is overseen by the U.S. Department of Education. Each year it becomes available October 1st. And depending on the programs that you're applying for, there's going to be different deadlines. So if you're applying for the Promise Scholarship, March 1st is our deadline. The West Virginia Higher Education Grant Program, April 15th is the deadline. And then for the Invest application, the priority deadline is April 15th, which means you can still apply after the deadline, but they recommend you get it in early so you can get all the different aspects of the application accomplished before the beginning of your next semester. So we can advance the slide. So the FAFSA is a 5-step process. And I know a lot of people are sometimes overwhelmed by the thought of filling out the FAFSA, but on average, it usually takes about 20 minutes for a family to be able to fill out the FAFSA. You enter in your student information. The FAFSA will help you determine whether you're considered a dependent or independent student. If you're considered dependent, you have to provide parental information, parental income information. If you as the student have worked, you would also have to provide your financial income and other information related to that on the FAFSA. And then last, you get to list your schools. So you can list up to 10 schools to receive this information. They won't do anything with your FAFSA information if you list them on there unless you actually apply to that institution. And so don't feel like you shouldn't send it to more schools. If you're simply interested in a school, I would recommend sending it to them because they're not going to do anything with the information unless you actually apply. And it doesn't commit you to anything at that point, but they will have that information if they need it. Next slide. So how do we determine dependency? If you are 23 or younger, you would have to provide parental information unless you can meet one of the other criteria listed. So unless you are a graduate degree student, married, have your own dependents, if you're active duty military or you're a veteran, or if you have been in foster care, an emancipated minor, and a legal guardianship, or homeless, documented homeless, or an unaccompanied youth, you would be considered a dependent student. As a dependent student, you are required to provide parental income information on your FAFSA to see whether or not you qualify for certain financial aid programs. Next slide. Frequent FAFSA errors we see. I'm going to emphasize this a lot because we see a lot of common mistakes or problems that can cause delays in your financial aid. And if you don't watch out, it can certainly cause major problems with you being able to qualify. So the first one is the Social Security number. So the FAFSA is overseen by the U.S. Department of Education, but they do cross-check the information on your FAFSA with other federal agencies, including the Social Security Administration. And so you need to make sure that your Social Security number is correct and that your name is listed as it is legally on your Social Security card. Otherwise, your FAFSA will get flagged and it'll come back as invalid. And you can't qualify for certain programs if your FAFSA is considered invalid because it would still be considered incomplete. Parent information. So make sure that parent information is going in the parent section and the student information is going in the student section. A lot of the times parents will go in and fill out this information and it's hard to remember we're putting certain information in certain sections. So you just want to watch out for that. Untaxed income and U.S. income taxes paid. A lot of times these get confusing because you're going to be pulling that information either from your W-2 if you have worked or your actual tax form. So just be careful when you're filling out the FAFSA online. When you're hovering over a box, it will tell you to the side exactly what information and what numbers you need to plug in at that point based upon the previous information that you've entered. And so if you're unsure, you can always call, use that help box and just make sure that you're plugging in the correct numbers from the correct documents. students. Household size, this is going to be how many people are in the household, and whoever is over that household is providing support for them. So number in post-secondary education, that is going to be how many dependents in that household are actually in school. And then the Fafsa year. So at any given time, there's going to be 2 available FAFSAs that you can fill out. So currently the 21-22 FAFSA is available because that is the academic year that we're in right now. But also the 2022-23 FAFSA is available for next year. And that's what most students are going to be filling out, is the one for the next year. So just make sure you're filling out the correct FAFSA year. Next slide. So they've made it a lot easier on the FAFSA to enter your income information with this IRS data retrieval tool. So for the FAFSA, you're going to be using 2-year prior data. And so for 22-23, that means the 2020 tax information is what is going to be pulled. If you use the IRS data retrieval tool, it will plug in all your information that are on your taxes that you've already filed into the FAFSA. So it does the hard part for you. It makes it so much easier. So if you're able to do this, I would highly recommend it. Just make sure when you're linking to the IRS data retrieval tool that you're using your information as it appears on your tax forms. And so if you spelled out street in your address on your tax forms, but you try to abbreviate it when you're linking to the IRS data retrieval tool, they won't match up because it has to match exactly as it appears. If there's two persons' names on that tax return and you invert the names and put dad first and mom second, or mom first and dad second, and they are different on the tax forms, it may not match up either. So just be careful when you're pulling that information that you do it correctly. Next slide. So federal student aid, or the FSA ID, you use this information to access all the online systems related to your financial aid. So you'll hear everyone say the FSA ID in the financial aid community, but it is referring to your federal student aid ID. This is how you sign your FAFSA electronically. And so it's important when you have this information that you keep it, because you are going to have to use it in the future. And it won't change. So you can't go in next year and just create a new one. They will recognize your information and they won't allow you to actually sign and submit your FAFSA if you don't have it. You do have to enter security questions and answers. So if you forget it, you can retrieve it that way. But I would just make sure you remember that so you'll be able to use it in the future. The one thing that I'll say about this is there has to be 2 signatures on the FAFSA if you are a dependent student. One is for the student. So they create an FSA ID and they sign and submit the FAFSA. And then at least one parent has to create an FSA ID and sign as the parent. These are linked to your email address. And so it does have to be 2 separate email addresses. So if mom goes in and tries to fill out your FAFSA and she uses her email address for your FSA ID, your FSA ID is going to have her email address, and she's going to have to figure out how to create a new one for her own FSA ID. You can also link it to your cell phone. So then when you do need to use it in the future, you can use that number to retrieve your information. So if you have that, I would recommend using it. Next slide. The FAFSA is available electronically. We do recommend you fill it out that way. You can fill out a paper form. It takes a lot longer, and it's going to take a whole lot longer to get processed. Financial aid is timely, and so the sooner you can get it done, the better. When you're filling out your FAFSA, you'll know that you are finished because you will get to that confirmation page. If you don't get to that confirmation page, you have not successfully submitted your FAFSA. So just make sure that you're getting all the way through. Once it is processed, it takes a few days, and then you'll get what's called the student aid report or the STAR report. You need to make sure that you review that and make sure that everything on your FAFSA was correct. If something's incorrect, it can affect your eligibility for certain programs. So you want to make sure that everything is correct on there, and that is your opportunity to do so when you get that STAR report. Next slide. If you do see an issue or you do see something that is incorrect, there's a few things that you can do to correct it. One is just go back to the FAFSA website, sign back in, make a change. Sign your FAFSA with your FSA ID, and that may require the student and the parent to both sign that if you're making a change, and resubmit. You can update a paper SAR report. I wouldn't recommend this. If you have the ability to do it online, do it online. If you update by paper, it's going to take forever to process because it'll have to be mailed in. They have to receive it. They have to review it. They have to process it when it gets to the U.S. Department of Education. But you can do it that way if you need to. Also, you can submit documentation to the college. So the financial aid office may ask you to submit something, and then they can also make a change on their end that would change your FAFSA. Next slide. Verification. So each year, the U.S. Department of Education randomly selects a certain percentage at each school for verification. And that just means that you have to verify the information that's on your FAFSA. It doesn't mean you're in trouble or you did anything wrong. They just randomly select students that have to provide information. If you use the IRS data retrieval tool that I was talking about, you won't be selected for verification because they know your information is correct. But if you didn't use it and you do have to provide verification, you would be required to get what's called a tax transcript. And then to do that, you would have to contact the IRS either by going to their website or calling the 1-800 number listed. Next slide. So on the FAFSA, if you've had any type of change, so we're using 2-year prior data, and that includes the income information. And so 2 years is a long time, and we know people's statuses can change, and that can certainly affect your income. So if your income has changed or the number in the household has changed, you can't report that on the FAFSA, but you can do what's called a professional judgment. And so a professional judgment is when you send an explanation to your financial aid office at your college, and then a representative of the college would be over the process to review it, and then they would decide whether or not they would make changes. So if you've had you or your parent have had a change in employment status, if they've lost their job or switched jobs and it's changed your income, they can go in and they can make an adjustment to your income information on the FAFSA. And that can change whether or not you qualify for certain financial aid programs. Other examples are medical expenses that you weren't expecting in the family, either for a parent or anyone that's in the household, or change in parent marital status. So if your parents get divorced, but really it's not limited to that, any other changes that happen to your income, you can certainly submit a professional judgment. The only other thing I'll say about that, if you don't know where you're going to go, you would have to do this at each individual college. And so each college has their own process for you to go through professional judgment. So if you're unsure where you want to go, you may have to provide that information to multiple entities. Okay, so how do we determine who qualifies for certain financial aid programs? We have what's called the basic equation of need, and it takes the cost of attendance minus the expected family contribution, and that determines whether or not a student has need. So what do all these numbers mean? We're going to go through that. So you can advance the slide. The cost of attendance, this is what varies. And so this will depend on what school you're planning to attend. And it includes tuition and fees, room and board, books and supplies, transportation costs. And so it will be different depending upon your specific situation and where you're planning to attend. So whether or not you live on campus or you're living at home, you're commuting, you have to drive to class, all those things are taken into consideration to determine your cost of attendance. Now, most of these things are predetermined, so you can't go in and say, I'm going to pay a different tuition rate. Those would be predetermined. Room and board would be predetermined, so they usually know. But there are some miscellaneous expenses like that wouldn't pertain to everyone that attends the school. And that could be something like you have a child and they have dependent care and you need assistance paying for them to go to child care while you go to college. So that could be taken into consideration if that's your specific situation. So that's cost of attendance. If you want to dive further into cost of attendance, you can use this website, collegecost.gov. This will allow you to compare the cost to attend different institutions. And so if you're looking at several different schools and you want to know what the difference in the cost would be, this would be a great resource for you to use to try to figure that out. Next slide. The EFC, so the reason we fill out the FAFSA is so that we can get what's called the EFC, which stands for Expected Family Contribution. And the expected family contribution, it includes your family's income, asset information is included in that, the family size, so how many are in the household again, number of family members in college. If you have a parent that's going back to college, it would exclude them. They can't be included in that number on your FAFSA as the student, but as the parent, when they fill out the FAFSA, they can be included, as well as the age of parent. And so the expected family contribution is the number you get when you fill out the FAFSA. And it's not necessarily what you're going to have to pay out of pocket to go, but it is an index number that helps determine whether or not you qualify for certain programs. Next slide. That includes federal financial aid programs. So federal programs like the Pell grant, which is a grant program that you wouldn't have to pay back, the FSEOG grant as well. A federal work study is a program where you actually work for the institution, and you can get experience in your department or field. So you could work in like a lab, and the school will pay for you and help offset the cost of that. The TEACH grant really wouldn't be for behavioral health students, but it allows them to receive federal funds as long as they have to agree to teach in an underserved area for certain years when they receive that grant program. And then also the federal direct loan program. So this is the federal loan program. If you do have to take out student loans, it would help you pay for the cost of college. Next slide. The federal Pell Grant, just so you're aware, this is for students who have an EFC on the FAFSA for the current year, $5,846, and you can receive up to $6,495. And that's for the current year, which is 21-22, and that sometimes fluctuates each year. But it is for undergraduate students doing their first bachelor degree or a professional degree. Okay, next slide. Institutional aid, again, check with your school to see if they have scholarships that are available for you. They have them based upon merit. There's also like athletic scholarships, dance scholarships. Sometimes they even have available need-based grants and loans as well. Next slide. The private aid, you can find additional aid sources through the community, your churches, your parents, employers, professional associations, corporations, and as well, if you have to, there are also private student loans that you can take out to help you pay. Next slide. So how do you start the financial aid process? You fill out the FAFSA. The sooner you get it done, the better. You also want to submit all the other applications, but to start the process, you want to research, and you're going to be researching like as soon as you can for future programs and even for next year and the following year. Next slide. One great resource is the College for West Virginia website, which our agency helps oversee. And it has all kinds of tools that are free for you to help plan, pay for college. So you can go through and find programs and majors. You can find each institution that they're offered at in the state if you're unsure what you want to do. They do have career planning, and they have different surveys you can take to try to help you determine that. But it also links to all the state financial aid programs, and that's that red circle. You can go to the next slide. And that'll take you here to the College for West Virginia website, which has all West Virginia state financial aid programs. Next slide. And you can see that here. And I'm going to speak very briefly about a few of these programs, but you can get more information on that College for West Virginia website. The West Virginia Invest Grant, there aren't a whole lot of behavioral health fields in this. It is for particular eligible programs, and it has to be at a community and technical college in the state. But if you do plan to attend one of the community and technical colleges, you want to look into the West Virginia Invest Grant because it can help you pay full tuition at one of those particular institutions, but it does have to be an eligible program. And there are a few behavioral health programs that are included. Next slide. We have the Promise Scholarship, which is a merit-based scholarship program, which means it has different academic requirements, and it does have a separate application, but that is available for students who are planning to pursue an associate or bachelor's degree program in West Virginia. Next slide. The West Virginia Higher Education Grant, this is like the Pell Grant, but it is for, it is West Virginia funded, and it's for students who are planning to attend on a full-time basis to an eligible school. The Fafsa is the application, and you need to get that filled out each year by April 15th to see that you qualify. Next slide. Also, the higher ed grant, you can receive this year an award up to $3,000. So it's a great chunk of change to help you pay for school. Next slide. The HEAPS grant is similar to the West Virginia Higher Education Grant, but it's for students who plan to attend on a part-time basis. So if you know you want to go to school on a part-time basis, you want to contact your school, fill out your FAFSA to see if you qualify for the HEAPS grant. Next slide. There's also the HEAPS Workforce Grant. This probably isn't too relevant to behavioral health programs, but it would be for students who are pursuing some type of certificate or short-term training program. The Underwood Smith Loan Assistance Program, I mentioned this because it can be eligible for students who are going into counseling. So if you plan to be a school counselor, once you graduate, if you agree to work in an underserved area as a school counselor, you can receive up to $3,000 to help you pay off your federal student loans. And so again, information's on the College for West Virginia website. Next slide. Our office does lots of outreach activities, and you can go ahead and go to the next slide. These are all the ones, all the webinars that we've had this year. So we do specific programs. We also do information more on the FAFSA to help students fill out the FAFSA. All these are pre-recorded and they're available on the College for West Virginia YouTube website. So you can check that out if you're interested in more information. We also help families, parents, students fill out the FAFSA. We can do that remotely. You just need to set up an appointment, and we can actually do screen sharing technology and help you through the process of filling that out. Next slide. Follow the College for West Virginia website on social media. And so you can find all those links on cfwv.com. They're at the top where it's circled. Next slide. Also, the Text for Success campaign. This is free, but text message rates apply, and you can get college counseling. And so they'll send you reminders about when you need to apply. Don't forget not to miss this deadline, and it will follow you during your senior year as well as your first 2 years in college as well. And these are helplines. So if you ever need assistance with federal financial aid or state financial aid, you can always send questions to us, and we're happy to answer. And that's all I have. Thank you. Oh, one more. Live chat. Will you go back one? Yes. So this is new in our office. We offer live chat Monday through Friday, 9 to 4, where you can go to our chat bot, and his name is Sam. And if you have any questions, you can send them to the live chat, and we'll be there to help you during business hours. If we're not there or he can't answer your question, it will submit an email to us, and we'll get back to you either by email or phone the next business day. And that's all I have. Thank you.
Great. Thank you so much, Tana. You covered so much in a half an hour. Great job. Next up, we have Stephen.
Hi, everybody. Glad to be here with you this afternoon. My name is Stephen. I have the privilege of working for the Bureau for Behavioral Health at the West Virginia DHHR. And when it comes to easing the financial burden or offsetting some of the educational costs The first thing I want for education, post-secondary education, the first thing I want you to hear is that there are various opportunities that you can take advantage of. And with all the resources listed here, I would really encourage you to take advantage of all that you can. There's so much to offer, and it would make sense to use whatever opportunities you can because we want you to be successful. So please make sure you follow up if you have questions or anything like that. So having all these opportunities to ease some of the financial strain of education, there are primarily two ways in which you could do that. There are, you can think of it like this, like scholarships and those grants that Tana was talking about that can help offset the costs at the beginning of your post-secondary education. And then there are loan repayment programs that can help reimburse some of the educational expenses that come towards the end of service obligations. So one of the ways that we do that with the great need that we have in the state, we want you to be successful. One of the ways that we do that is through the Bureau for Behavioral Health's Stellar program. And Stellar, you know how we love our acronyms at the state. Stellar stands for Statewide Therapist Loan Repayment Project. And so this incentive is tailored for early entry level, master level counselors, social workers, and psychologists. And so what we do is we try to tailor this in order to reach and recruit as well as retain new master's level therapists for the state. And we do that by offering awardees up to $20,000 in educational expense repayment, loan repayment, in exchange for a 2-year service obligation with an eligible employer in the state. And as of 2022, we've also included nurse practitioners and child I can't read that, child psychiatrist, I think. Yeah, I should know that. Anyway, based on key performance indicators and needs of the state, we also give preference to applicants who practice in the Eastern Panhandle, Southern West Virginia, and those areas that are deemed as underserved and rural areas of the state. It's also tailored for those candidates who have themselves that lived experience when offering the SUD related services at these eligible organizations listed here. It's important that we help not only our West Virginians who are in this fight, but also for those that are coming out of those personal struggles as well. So we try to give preference to those applicants who themselves have that lived experience. So once you get through high school and you start your post-secondary education and you start to look around for the places that you want to be employed, you can see the list of eligible employers here. If you're ever unsure of the status or what kind of employer you have, the best thing I can do is just suggest that you ask, because sometimes people don't know what kind of entity they're working for, so you can always ask. And in addition to that, Carolyn, if you don't mind to scroll down, also wanted to point out that at the bottom of this Stellar webpage here, we also have links to other state and federal incentives that might be of interest to you. So I think Heather and Michelle are going to cover some of these later, but just as an example, listed within these links here are opportunities like those that are provided by the National Health Services Corps, who sometimes offer even more funds as an award, but it also comes with a little bit longer obligation period. So just to keep that in mind. And again, what I want you to hear me say is that there are lots of opportunities out there to take advantage of. Do your research. Don't be afraid to ask questions. And yeah, thank you that's the link for the webpage. And we want you to be successful because we want West Virginia to be successful. So please reach out if we could be of any help. And again, thank you for your attention and for all your great work.
Okay. I am Michelle Rupert, and I am with the Division of Health Sciences at the Higher Education Policy Commission. I'm going to talk to you today about the Mental Health Loan Repayment Program and the Health Science Service Program. I'm going to try to not talk too fast so you guys can understand me, and I hope everybody can hear me all right. Carolyn, go ahead and flip to the next slide. And quick history. This is a fairly new program. The Mental Health Loan Repayment Program was established in 2019. So it's still in its infancy. It is for working professionals in the mental and behavioral health profession. So this is for once you guys have graduated and you are out in the field. And I have another program that is for when you are still a student and then once you've graduated. And I'll talk about that one here in just a little bit. This is for recipients who, once you've graduated, you're out in the field, you can receive up to $10,000 your first year, and you're a total of $30,000 if you commit to up to 3 years of service. Now, this would be a year at a time, so you wouldn't be committing to 3 years, you'd be committing 1 year at a time unless you go part-time, and then you'd be in a 2-year contract. Our first year is just now wrapping up, and we are giving out $230,000 to mental and behavioral professionals in West Virginia this year. Next slide. The eligible professions for this program are licensed doctoral clinical psychologist, master's level psychologist, licensed independent clinical social workers, licensed certified social workers, I'm talking too fast, licensed professional counselors, licensed marriage and family therapists. You have to certify that you have at least $10,000 in debt, but let's say, for example, you only have $18,000 left in your student loan debt. You can apply for the first year to have your $10,000 wiped out, but then that second year you can still apply. And for your second award, you will just be awarded, the $8,000 and change that you would have left over for your debt. But that first year, you do have to have at least $10,000, and that's due to the way our legislative rule is written, unfortunately. And all of the applicants must be working and living in West Virginia. Your service obligation, you will sign a contract to work at least 1 year in West Virginia. If you're full-time, or part-time, you'll work for 2 years, and you will work in an underserved area. And like Stephen had just said, if you're not really sure if your area is underserved, the best thing to do is just to ask. Shoot me an email, give me a call. We kind of work as BPH does. We use a lot of the same designations. We also base our designations off of HRSA and HISPA designations. So if you're unsure, the best thing to do is just go ahead and give me a call. I'm just going to touch on that because I know a lot of you are students and this is not going to apply to you for a few more years. Go ahead and Carolyn to the next slide. Applications for this program are open now. So if you are a working professional, go ahead and apply. If you think you are eligible for the program, you can reach out to me. The applications are on collegeforwestvirginia.com/programs. There's a drop down and you'll see the little logo there that is to your right, and just click on that and there will be an apply button. You will need to submit proof of your licensure degree with the application, in additional to 2 professional references, which you will get a very detailed email at the end of your application that will give you information for that. Next slide, please. All right, let me go into the Health Science Service Program. This is our other program, which is a little bit older. It was established in 1995. It is also funded with state dollars. It is a loan repayment program for health and behavioral health professions. Your students must be interested in staying and practicing in West Virginia underserved communities. You can get up to $15,000 for a 2-year service obligation. And since 2015, we've awarded over $150,000 to clinical psychologists and licensed independent clinical social workers in West Virginia. Next slide. You must be in your final year in an eligible discipline of clinical psychologist or clinical social worker. You must be interested in working in an underserved area of West Virginia during your service obligation period, which will be for 2 years for a 1-year for 2 years for your service obligation for full-time, or a 4-year contract for a part-time. You must finish your internships before you actually start your service obligation. So for clinical psych, that would be your 1 year, or for social worker, that would be your 2-year supervised internships. Next slide. As with the mental health loan repayment program, there is a service obligation. It basically is the exact same criteria. We go with BPH and the HRSA designations. So again, if you're unsure if your facility or your practice would meet the criteria, you can just reach out to me, and we can look into that and see if your patient population would meet the criteria. Next slide. This program runs from July 15th and to November 15th annually. It's open to any eligible student that's in a West Virginia eligible college with Psych D or social work program. All of the applications are online at the College for West Virginia website. Right now, unfortunately, everything is still paper, but I am hoping to get the application online. I don't know if it's going to be this year, but hopefully soon. And there are 2 additional forms to submit, which is your certification of educational status and your professional references. Next. The last thing I have to tell you is you can bridge these 2 programs together for a total of $45,000 in student loan repayment. You can, as a student, graduate with clinical psychology or an LISCW and do the health science service program service commitment. And then once you finish that, you'll be a practicing professional, and you can then apply for the mental health loan repayment program and do your 3 years of service obligation and get $30,000 in loan repayment. So I just want to tell you about that program. If you have any questions at all about either of those, I thank you for your time, and just shoot me an email or give Carolyn an email, and thank you. Have a good day, everybody.
Hi, I'm Heather. As Carolyn said earlier, I work for the West Virginia Division of Primary Care, and our office is the liaison for National Health Service Corps programs for the state. Next slide, please. So National Health Service Corps, like some other programs, provides assistance to providers in certain community types. Sort of like how Michelle mentioned, you have to be in a HIPSA, and there's other requirements that are posted later in the presentation. Next slide, please. So National Health Service Corps requires the facilities to be an approved site before providers are eligible to apply for National Health Service Corps awards. The specifics are listed there, and more can be found on the website, which there's a link later in the presentation for that you can look at later. But in short, for those of you that may be interested, or when you're looking for jobs, you can ask the facility if they're already a site, and then if not, would they be interested in being it, or do they know anything about the program, or if they're eligible. As I said, the site has to be in a HIPSA. They can't discriminate services based on the ability to pay. You have to have a sliding fee scale, and you have to have the ability to accept Medicare, Medicaid, and CHIP. Next slide, please. This is an overview of the 3 National Health Service Corps loan repayment programs. So all of them require you to have a service obligation, and you cannot have a service obligation with any other program while you're doing National Health Service Corps. Most all of them are 2-year options for different amounts of money. So full-time versus half-time, as you can see on the column right there, or the row right there, it says award amount. It'll give you the different breakdowns of each potential amount. National Health Service Corps loan repayment is a 2-year commitment, and then the other 2 are 3-year commitments. Next slide, please. So for National Health Service Corps loan repayment, you can get up to $50,000 for a 2-year full-time commitment if you work in an approved site in a high-need area. Next slide, please. So this is a list of eligibility requirements. They're mostly the same for all the programs. In the interest of time, I'm not really going to go over them, but the highlights are: you have to be a U.S. citizen, you have to have student loans, of course, and then you have to be able to bill Medicaid, Medicare, and CHIP for your services, and your license has to be unrestricted. Next slide, please. So this is a list of specialties that are eligible for the National Service Corps loan repayment. For primary care, it's just nobody's interested in that, so we won't go over that, but it's MDs, DOs, nurse practitioners, and PAs and certified nurse midwives. As you can see, for behavioral mental health, there's a expanded list there. Next slide, please. So National Health Service Corps Substance Use Disorder Workforce Loan Repayment Program, you can get up to $75,000 in exchange for a 3-year commitment. And for this program, the big key is you have to provide substance use disorder treatment. Next slide, please. As you can see, the behavioral health specialties are a little bit more, and it includes pharmacists and registered nurses, which aren't in the other program. All right, next slide, please. So for National Health Service Corps Rural Community Loan Repayment Program, you can get up to $100,000 for a 3-year full-time commitment, or up to $50,000 for a 2-year half-time commitment. Next slide, please. Same eligibility criteria as the SUD program, except it has to be a rural site for this program. And eligible disciplines are the same, except you can be a certified registered nurse anesthetist. Next slide, please. When you access this on your own, all of those will take you directly to the sites for those programs. So you just click on it and it'll take you to those programs. Next slide, please. There's my contact information if you have any questions. Most everything can be found on the National Health Service Corps website. Unlike some of the programs discussed earlier, everything is online, all the applications, and the feds have all this say. Our office just acts as like a liaison to answer questions or to promote the program, but all the final decisions and the rules are made by HRSA. If you have any questions, just email or give me a call. Thanks.
Heather, thank you so much. Really appreciate. Join me in the chat in thanking the 5 speakers for that session. They covered a lot of information. Their slides are already available on the website. So if you missed something, or if you missed part of the session, or if there was a link you wanted to follow up on, go on over to that website and check out the links to their programs. I think the main point that these 5 speakers were really trying to get across is that your education to become a behavioral health professional is attainable. It's affordable. There are lots of different options. I loved, Michelle, your bridge slide where you showed, the possibility to partner up a couple of these programs together and be able to pay off quite a few loans. So, going all the way from how do you decide what to pursue to scholarships, looking at grant programs, and then looking at loan repayment options. There was just so much information covered. So thank you all so much. We're going to keep rolling on to our final session. I'm so excited to introduce this Surviving College Q&A student panel. We have 4 students that are, or 3 students that are going to be joining us, and then 2 professionals. I am going to go ahead and turn it over to our moderator, Heather McChesney, who is going to introduce the panelists. I will let you know that Ashley was having a little bit of difficulty with her audio, so if she can't hear us and join right away, she'll be joining us once we get that worked out. But turning it over to you, Heather McChesney.
Hello, good afternoon, everybody. My name is Heather McChesney, and I'm the coordinator of curriculum and professional development here at the West Virginia Higher Education Policy Commission. And today we do have 4 other individuals that are going to serve as panelists to talk a little bit about surviving college and how that has worked out for them, is working out for them. I'm going to give a brief introduction of all 4 of them, and then I'm going to turn it over to each of them for a couple of minutes. So that they can briefly briefly tell us a little bit about themselves, about their education and their career path that they're currently on or they have already been on in the case of Autumn. So first up, we have Caleb Stevens. He's in his first year of master work, specifically in social. He's a social work student at Concord University. He is currently working as a full-time case manager in adult mental health. And afterwards, he plans to pursue his sorry, you can tell I've got my brain working in the K-12 field, LICSW and practice therapy. We have Samantha Kinnear. She's a junior psychology major and she's at Marshall University. And after graduation, she plans to pursue her master's in her career also in counseling, which is great. Ashley Yoho, I'm hoping I'm pronouncing that correctly, Ashley, and that I'm not butchering your last name. Good. She's a senior psychology student as well, and she's there at West Liberty University. And after graduation, she plans to attend West Lib's Master of Arts in Clinical Psychology program and become a licensed clinical psychologist here in the state. And we also have my coworker, Autumn Perry, who's the College Access and Success Program Director here at HEPC, and I'm sure she can give you her alma mater credentials as well. But we can go down the list there and start with you, Caleb. If you'll just give us a few minutes and let us know a little bit about your trajectory, why you do what you do, how you got into this to begin with.
Yeah, I would love to. Can you hear me okay?
Yes.
Okay, great. Well, it's great to see everybody, and it's mostly undergraduates. Is that correct on the call, or high school?
We've got a combination of both.
Okay, great. Well, thanks for the opportunity. Really been looking forward to this, just getting to know everyone and spend some time with you. My career path has been, well, I'll start, I guess I grew up in Camp Creek, West Virginia, really small town. And my career path has been a little unusual. I joined the Navy, so I did my undergrad in Maryland, and I did a bachelor's in engineering. So nothing to do with human services, really. But then I went in the Navy, so I was in that for about 10 years, and I really found that working with people in the military was what I loved. So I would work with sailors, and sometimes they were having financial difficulties, sometimes they were going through divorce, you know, you name it, struggling with just all the normal life stuff that we all go through. And I found that was what I found really rewarding, spending time with them. And I had no idea how to transition into like a counseling or human services type field, but a very good friend and mentor told me about the master's in social work. And he explained that you don't really have to have a bachelor's in social work to do the master's as long as you've had some humanities. So I had been thinking about that for a few years and decided to go ahead and apply to Concord's MSW about a year ago. And so I got out of the Navy, started at MSW, started a job here in Southern West Virginia at a community mental health center. And I'm in the second semester of the MSW. So really excited for that career change.
Great. Thank you for sharing. We'll move on over to you, Samantha.
So I'm currently in the undergrad program for psychology at Marshall University, like you said. I've always kind of had an interest in psychology, just different kinds of helping fields. Actually went to fashion school right out of high school because I had moved out to California, and then I moved back here to West Virginia. And obviously that's not really something you're going to use out here a whole lot. So I went into the childcare field and worked in childcare for 12 years. And I just always kind of wanted to do more with that. And then about 4 years ago now, I found the program Celebrate Recovery. That's a 12-step program, not only for people with substance use disorders and struggling with that, but also for mental health disorders, anxiety, depression, and basically grief, anything that you are just having a hard time dealing with in life, you can go and work through this program. And I really fell in love with just the whole, I love working with people in recovery, with people that are struggling with mental health issues. So I decided when the pandemic hit, was having a hard time with work and stuff, and getting enough hours at work. So I decided that was a good time to jump back into education and got enrolled at Marshall about 2 years into my degree plan, plus the transfer credits that I had before. And then after I finished my bachelor's program, then I'm going to go on to the PsyD program and hope to open my own therapy practice one day.
Thank you. That's fantastic. All right. How about you, Ashley?
Hey, everyone. My name is Ashley Yoho. I'm currently a senior at West Liberty University. I'm a non-traditional first-generation commuter student, meaning that I'm a first generation out of my family to acquire a college education. And I didn't go right to college after high school. I went to the workforce. I'm currently 26, and I'm just now finishing up my bachelor's degree at West Liberty in psychology. I completed my associate's degree at first from West Virginia Northern Community College in 2016, and decided to return to higher education to complete my bachelor's from West Liberty in the spring of 2020 when COVID-19 broke out. I've had a couple rough semesters since then, but it was doable. I actually just got my acceptance letter for West Liberty University's Master of Arts in Clinical Psychology program, and I'll be starting that this upcoming fall. In addition to furthering my education, I've held numerous jobs throughout my college experience, and I've also gained an internship experience at various equine assisted psychotherapy centers and therapeutic riding centers throughout the area. Once I complete my master's program here at West Liberty and my clinical experience hours, my goal is to practice as a licensed clinical psychologist in the state. And I want to utilize traditional therapy sessions while also implementing some of the things I've learned in the equine assisted psychotherapy into my treatment plan for my future clients. For further information on this relatively new model of an alternative therapy, it is a experiential therapy that utilizes a psychotherapist or a mental health professional along with the use of horses for the betterment of our physical and mental health for individuals who suffer depression, anxiety, ADHD, post-traumatic stress disorder, addiction, trauma, and autism spectrum disorders. It's a relatively new therapy, but I think that's really what I want to do with my future eventually.
Great, and congratulations on your acceptance. That's fantastic.
Thank you.
You're welcome. All right, Ms. Autumn.
All right, so as Heather said, my name is Autumn Perry. I am College Access and Success Program Director at the West Virginia Higher Education Policy Commission. And the pathway that brought me here, I went to college right out of high school. I attended Potomac State College and earned associate's degrees in psychology and sociology, and then transferred to WVU main campus and finished out the bachelor's degree in psychology. After that, I went to work for a domestic violence organization that served the survivors of domestic violence and their children. I worked there for about 2.5 years, and then I decided I wanted to continue my education. So I found what was a pretty new program at the time, a Master's of Arts in College Student Development and Administration at Shepherd University. So I did that graduate program, and during grad school, I was fortunate to be able to work on campus as an academic advisor and work in the Career Development Center there on campus and be able to help with some college access programs that went on over the summer there. And I just fell in love with those. And shortly after graduation with my master's, I started work at the Higher Education Policy Commission. And I've held a couple different positions there through the years. I've been there since 2009, and here I am.
Well, thank you guys very much for introducing yourselves and providing a little bit of background knowledge on who you are, your journey to get where you are and whatnot. I do appreciate that. For those of us that are tuned in today, those of you all that are tuned in today, this panel is about surviving college. And we do have some pre-made questions that we're going to ask the panel on how they're surviving college, some tips and tricks on how those of you that are in high school, what you have to look forward to and how you can survive college. For those of you that are undergrads that are looking to make that next step into graduate school, how you can get prepared to make that next step in your journey as well. With that said, though, we've got that chat box open. A lot of these questions are, I don't want to say they're vague, but they're generalized. If you have very specific questions that have to deal with this particular pathway, with the topics that we've been addressing over the last 2 days, with these plans of study that these individuals have been embarking on, please put those questions in the chat box. We want you all to pull from this everything that you need and want because this is for you all. This is for your betterment and for the knowledge that you need to, and all the takeaways. So that's what we're here. And I am looking at the chat box right now, and Carolyn has said, we do have a couple of door prizes still available to anyone who sends a question in for the panelists. So utilize that chat, please, 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 about anything college survival. So to our panelists, are you guys ready for some questions to come your way? I'm going to put you on the spot a little bit. So let's start with just some general questions to help. This is for our high school students as they're starting to look forward to their next steps after they graduate from high school. They're on campus that first semester, or they're starting to think about that first semester. Did you guys work while you were in school at the very beginning as a freshman? Did you hold a part-time job? Thumbs up if yay, thumbs down if no. Does anybody want to elaborate on their answer?
I would. At our introduction to college course, we just had to go in for like a couple hours, and they were giving us advice on how to do well in college. And the advisors told us directly, do not get a part-time job because you will either quit school or you will quit your job. And I know a lot of people tried and they were totally right. So if it's at all possible, I would definitely try to avoid trying to do both, especially as you're kind of getting used to the school, the workload and everything. But I have later in college, I've worked a full-time job and done full-time courses at the same time. So if you do need to go that direction, it definitely is possible.
Anybody else want to elaborate, have a different viewpoint? Yes, Ashley.
I worked during my associate's degree at West Virginia Northern Community College as a math teaching assistant in a tutoring center. It was an easily available job. I helped teach and help the professor grade assignments it was for minimum wage. It was considered a work study through West Virginia Northern, but it was a great opportunity. Like I said, it was only part-time, but it was manageable with the workload.
Sure. So I think one of the instances that one of the differences we're seeing here is maybe off-campus jobs compared to on-campus jobs too can make a difference, like part-time versus full-time. And I do think that it's based upon the individual and your schedule. I think we've got to be really realistic about what we can take on as individuals. Don't you think, guys? Okay. So the next question. When you were first starting, for those of you that weren't commuters, for those of you that lived on campus, did you pick your roommate or did you go potluck? And when I say potluck, to those of you that are still in high school, potluck is when it's the luck of the draw. You meet your roommate the day you move in. Go for it, Caleb.
No, I did not pick my roommates. It was pretty random, and that presented some really fun times and some challenging times. I think one thing that I had to learn that was a little uncomfortable for me, and I don't say this in a negative way towards anybody or anything like that, but if you don't pick your roommates, you may get along with them really well, like you may actually become best friends organically, but also you may just live in two different worlds. You know, you're a psych major, they're a physics major, and you're just like very different people. And I think for me, it felt a little awkward at first to kind of like, because I'd only lived with my siblings growing up. So your family, you feel like you have close relationships. So this was kind of new terrain to be like, hey, how's it going? And just let them go about their business and I go about my business. But with some of my roommates, that's how it was, because I got paired with them randomly. And then some of them I actually did get really close to and still in touch with them. So.
Anybody else would like to address that? And if not, that's okay. All right, let's hone in on something, not that was frivolous or silly, but something a little bit little bit more serious. And so you, several of you alluded to this when you were doing your introductions earlier. Is it okay to change your mind about what you want to do, your major, your career, your school? And when that happens, what do you do? Anybody can take it from here. You guys don't have to be so polite. Go ahead.
Personally, like I said, I did not go to college right off the bat. I didn't know what I wanted to do. And I think that's okay too. You know, not everybody has to follow one path in life. And I think that's important to, you know, let people know that if you don't know right away what you want to do, you do have time to figure it out and take some time for yourself to even experience life and learn about yourself. And when an instance does arise where maybe you do want to change what you want to do, that's okay. It's good to establish connections like with an academic advisor to help you along such processes like that of changing your major. I changed mine from physician's assistant career pathway to clinical psychology pathway, and I'm very happy that I did.
So piggyback on what Ashley has said, you know, if you're already in your first part of your undergraduate education and you realize that maybe this major is not for me, maybe this isn't what I want to do after all, as soon as you start having those thoughts, I would recommend, like she said, going and talking to your academic advisor immediately. They can talk to you about other majors that might be of interest to you. Maybe you have some classwork that would easily transition over into that major and count for the credits that you need for that, just looking at it from the academic front. Also, if your campus has a career development center or a career services center, talking with them, they have a lot of tools and resources they can work with you on, interest inventories and different activities and things like that to help hone in on your interests and some of your goals, and then match those up with majors offered there on your campus. And then of course, if it turns out that, you know, you want to do a pathway that's not available at that particular school, then you may be looking at transferring to a different institution, and the academic advisors can help you get started with that process as well.
I think one of the things that was challenging for me to kind of learn in this area is we put a lot of pressure on ourselves about like making the right decision. And my perspective on that has completely changed. I don't really believe that there's right decisions. It's more like, I think Ashley kind of said, there's lots of different paths, and you can be going down a path and kind of realize, oh, you know, I'm here, I'd rather be over here a little ways, but you just deviate a little bit in a new direction. It doesn't mean that what you've already done is wasted. Like I've been in the Navy, and I'm not going to retire from the Navy, but I gained so much through that experience. And it doesn't have to be the Navy, you know, it can be 10 years as, you know, 10 years in the restaurant industry, and then you decide to go a different direction, or 10 years as a parent, and then you decide to go back to school or something like that. And so just, you know, for me, learning to put less pressure on myself and just kind of be open to the idea that, hey, maybe I can change my course a little bit. And that doesn't, it's not a huge deal. I'm still moving in a positive direction, and I'm still going to live a meaningful life that I enjoy, you know. I think that's how my perspective is on it a little bit more now in my 30s.
I agree with you. I think we're all still trying to decide what we want to do when we grow up. And I think that's okay. Samantha, was there anything that you wanted to add to anything that they had to say? Or are you in agreement with most of what they said?
Yeah, I would echo everything they said, especially like I think it was Ashley that said to talk to your advisor if you are going to change paths, because my advisor has been an awesome help. I was actually between social work and psychology, and not only did she help me decide that psychology was the right route for me to go, but she also taught me, I had no intention of doing the PsyD program. So she helped me understand what programs were available and the differences between what I could and couldn't do. That way I didn't get too far into that coursework, and then change directions again because I understood where I was going from talking to her.
I think we're all in agreement that your academic advisor needs to become your best friend while you're on campus. And regular meetings with he or she need to be scheduled often. We do have a couple of questions that have come in on the chat box here. I've got 3 of them actually, and I believe, if I'm not mistaken, all these students are coming to us from Tyler Consolidated. If I'm wrong, I apologize. But Hannah Rose has a question for you all. How do you keep a social life without ditching your schoolwork? How do you find that balance, guys? And I think that's a great question, because we all know that self-care falls into this. You have to have a social life. You have to, see your friends, see your family, but your studies are just as important. So how do you keep that balance? Let's address that first.
Well, one difference between college and high school is that the time that you're actually in a classroom is a lot less per day than what it is during a high school schedule. So you've got a little bit more free time each day just because your course time is less. And just like high school, there are going to be times where you've got big tests coming up or you've got big projects coming up that you have to focus a little more time on study or homework and that kind of thing. But there are also other times where, maybe you don't have as many assignments due and you can go out that weekend and see your friends or get involved in some campus activities that you enjoy. And that, as Heather said, that's very important too, just for your mental health and, enjoying the whole college experience.
I think one of the things that lesson that I had to learn, and I'm still learning, but growing in, is cultivating relationships with people who were encouraging and were wind in my sails, instead of kind of dragging me down a little bit. So there's a social aspect to studying. I have some very good friends, and we would have some great times at 11 o'clock at night in the library, bouncing the homework questions off each other and trying to work through stuff. And those were also the guys that I spent time with outside of school, just hanging out and chilling. But I didn't always succeed at this. I certainly can look back and see some bumps along the road. But those were the guys and gals that I tried to really, build relationships with. And I think that it was like a positive feedback loop. My social life contributed to healthy academics, and my academic life kind of also helped build those social ties.
I think self-discipline is a big part of knowing when you can have your social time and when you have to, manage your time for your studies. So that was the biggest thing for me, is telling myself, okay, I can have social time after I get these assignments done.
I echo that, Ashley. I think prioritizing your time and time management is a key. I'm 45 years old, and the lessons that in the prioritizing, that was a lesson that I learned at 16, 17, and 18 years of age that are still very much ingrained in my brain at 45. Heather, you can't do X, Y, and Z until you get A, B, and C done. You've got to get the hard stuff out of the way before you can go and have a good time. So I'm with you on that, the self-discipline. Samantha, is there anything that you'd like to add? And if not, that's okay. We can move on to the next question. It's up to you.
Yeah, my friends and I actually set an appointment every single month, and we just do it one time a month, that we get together on a certain week, certain day, and that never changes. And it actually helps with my studies too, because that's motivation. I know, if I have a big project coming up the second Tuesday of the month, I have to get it done before I can go out. So it kind of
That's a great idea. That's really great. I love that, Samantha. I might have to start instituting that with some of my friends. That's a fantastic idea. So we've got a couple other questions here in the chat. One from Leah. How do you deal with assignments from professors that seem impossible? And that's something that I'd like you guys to address too. What's the coursework like in a college setting as compared to your high school courses? So let's start with that first, because, is it a myth? Is college 10 times harder than high school? Is it the same? What are the similarities and differences? So how do you deal with how do you deal with the work on the college campus?
So I know they give you the syllabus at the beginning of the year, and almost every class I've had, you have at least the big projects and most of the smaller homework assignments. So you know kind of what's going to be coming up. You can sometimes work ahead on a lot of that, which I try to do that as often as possible. And then when there is things that are coming up and you just feel like it's absolutely impossible, I try to just remind myself, like, I do not have to be perfect. I do the best that I can. And if I do miss out on an assignment here or there and I don't get the grade that I wanted to, then it's okay. And I can move forward and kind of just forgive myself for that, knowing that I put in everything that I needed to put into it. But sometimes you won't get the perfect grade that you want. But you can also talk to the professor too and find out exactly what they're expecting from you. They're always willing to help. I haven't had any yet who have just been like, too bad, figure it out. They've always been willing to answer the questions and work with you step by step until you get what they need from you.
One of the things I would echo there, Samantha, is talking to the professors, contacting them. It's a really good question. I'm talking specifically about the tasks that feel impossible, because there's two things that can make an assignment feel impossible. One is like, it really is a huge assignment and you have a ton of work to do. And if it's that case, then starting on it early and working a little bit at a time, you'd be amazed how much of a difference that makes. And then when the assignment's about due, you feel like you have this mountain of research you've already done, and it's not hard to put into words. Let's say you're writing a paper. It's not so hard to put into words what you're trying to say. So just break it up and take it a little bit at a time with an assignment that's really huge, and that's why it feels impossible. But I had some assignments that felt impossible because I was confused and I was spinning my wheels and I didn't know what I was doing. So I was wasting a lot of time on them. And I was kind of embarrassed and like, I used to be really, really shy when I was young. And so I was really hesitant to email my professors. I would think, well, maybe I'm missing something, maybe they're going to think I'm dumb. And, they're going to kick me out of the class. I had all these worst case scenarios in my mind. And what I had to gradually learn was they're there to help and they want you to succeed. If you have a professor who's a psychology professor, they want you to succeed. They're not trying to like keep that degree away from you, because we are desperate for people in the mental health field. So when you email a professor, you'd be amazed at how helpful they are and how they'll answer questions and just clarify. And then you're like, okay, got it. Now I can start making progress.
Thank you guys very much for answering that. If I can offer my 2 cents, when your professors offer up office hours, go take advantage of it. When your professor knows your name, that's a good thing. You want them to know who you are. You want to have a relationship with them, just like your academic advisor. We've got another question in here. Was the change from high school to college difficult for you guys? And I know each of you have took a little bit of a different path to get where you are. So how was the transition for you once you entered your undergraduate program? Was it difficult?
I think the hardest part for me, transitioning, going back to school, was figuring out my work schedule with my class schedule with all my assignments, because I did wait. So that was one of the hardships that I faced, taking a break and then deciding to go back. But one of the things that really did help me in my transition is I use my planner for everything. It is my lifeline. I start at the beginning of the semester when I get my syllabus, and I use it as sort of like a timeline of when to expect to have certain parts of assignments done. That way I just stay on top of everything, and I'm not procrastinating doing everything last minute. That was probably the biggest thing the biggest difference between high school and college is you don't want to wait to procrastinate. And I know, and this isn't the case for everybody, but in high school, I was the type of person where I didn't feel like I needed to study for every single test. College is definitely a different story. I feel like I do spend more time studying the actual materials that we cover in classes, as opposed to what I did when I was a high school student.
Hey, Ashley, do you still use an old school planner, like a little book?
I do, actually, I do. A lot of people I know use their laptop for everything, but I do use the actual, there's something about writing it down. It makes you, you're more motivated to check that off your to-do list.
I agree with that. I use Google Calendar because for some reason I can keep up with my phone, but I'd never be able to keep up with an actual booklet, but I do like it that way.
I actually have two calendars. I have one that I keep in my backpack. That way I can write all my school stuff in there. And then I have one on my desk at home. So as soon as I get home, start working on homework, I transfer everything from the school notebook into my personal notebook and vice versa. That way I've always got whatever plans I've got coming up, assignments I have coming up, they're in both places, written it down twice so I remember.
You guys are on top of it. I live by my brain, by my calendar. Without it, I don't know where I'm supposed to be most of the day. So you guys are off to a good start making great habits. I applaud you on that. We've got a question here. Oh, no, so Carolyn said, my college roommate gave me the advice to always ask a question, any question during the first class so the professor will know who you are right away. That's brilliant. For those of you guys listening and watching, that's your homework the first day of class once you're on a college campus. Ask a question, any question on the very first day so that professor knows who you are. Good advice. So we've got a question here from Michelle Campbell. How do you all prefer to learn? Do you prefer online classes or face-to-face in a classroom? And guys, we know that we've all had a lot of experience with both over the last few years. So I'm going to turn that on over to you guys. Which is your preference? Because we know there are pros and cons to both.
My personal preference would certainly be in person. Nothing beats that face-to-face, being able to interact and just kind of be in your surroundings, fewer distractions and that sort of thing. But of course, online, there are some benefits, if sometimes just for convenience, you don't have to go anywhere. It cuts down on travel time and that sort of thing. And you can multitask if you have to. So it is convenient to have online offerings sometimes, but I certainly do enjoy in person more.
Yeah, I really prefer the in-person too. And kind of going back to that, asking a question on the first day, it makes it a lot easier to get to know your professors and to get involved on campus in other ways too when you're in person.
I would have to say I prefer in person as well. My bachelor's was all in person. My master's is all online. I'm still getting a lot out of the master's though. So I think if you're going into undergrad and you have the option of doing in person from a financial and timeline and all of that, then that's what I would do. But online, you get a lot out of online too.
I agree with all of you. I definitely prefer face-to-face interaction. With starting my bachelor's degree at West Liberty during the semester that COVID-19 broke out, all of my classes went online, and it was a rough transition at first. But I definitely prefer face-to-face interaction. I just retain the information so much better and feel like I'm teaching myself more of the material in an online formatted class rather than someone explaining it to me more in depth.
Thanks, guys. So I have a question on behalf of our current collegiate students that are there that are most likely prepping for grad school. As you all were preparing for your next step to go to grad school, did any of you guys take any GRE prep courses? And if so, can you talk about that? Would you recommend that? If not, any thoughts on it?
I took the GRE. It's kind of ironic because I didn't end up needing it for the Concord MSW. It wasn't required, but I was thinking about some other programs that it might have been required in. I didn't do a prep course, but I got one of the books, and the book was really good. The mistake that I made in studying for it was I'm fairly strong in like writing, communication, those types of skills. I'm not so good on math and the technical side. And we have a tendency to study to our strengths. So I studied a lot of vocabulary and studied like how to write the essays and stuff. And I didn't really force myself to study the math side very much. And when I took it, I did a lot better in the areas that were already my strength and was kind of lacking in the math side. As I reflected, I was like, well, that's because I didn't really study for it. So the study material is really good. Like it's very accurate to what's on the test.
I did not take a GRE. The program that I was going into at the time did not require one, but I would certainly recommend for anybody thinking about grad school to take any preparation that you can find, particularly if you can find anything low or no cost. It's always better to go into any circumstance prepared rather than not. And I will mention on cfwv.com, we do have free GRE prep tools on there. So that's something you can take advantage of if you want to find something that won't cost anything.
I just want to touch base on West Liberty's Masters of Arts of Clinical Psychology program. They do not require a GRE score. They do offer, an alternative. You have to provide them a score with the major field test before, which is basically the same roundabout test, as a GRE. We're actually required to attend a senior seminar course where we practice for the major field tests. So it's sort of similar. They have practice tests, assignments, stuff like that to prepare us.
Great, thank you guys. And Autumn, thank you for plugging CFWV. We do have free test prep there. And high school students, we also have free test prep for your ACT and SAT as well. So make sure you take advantage of that so you can pop those scores up and qualify for, all of the things. We appreciate you doing that. So I'd like to move on to this, guys. Each of your campuses happen to have lots of resources available to their students. How can students become aware of what those resources are and where to find them? And I'm talking about resources like financial aid help, academic counseling, career advising, academic programming, credentialing, wraparound services. How can new students or even existing students that have been there for a while become better informed about what a campus has to offer and plug themselves in to the resources that they may need?
There's usually like a student resources or student information center or office or something at Concord. It's in the student center building. And I think the, like if you entered from the main front doors and went up to the second floor and you turn left, I think that's where it is. It's been a little while since I've been there. But that's kind of your hub, your go-to place. And they've got people working all the time and their whole job is to just, you walk in and they have that information for you. So they can really, you're not going to like get all the services there, but they can point you in the right directions.
Another big thing that you can do is make sure that you attend any orientation or advisement registration sessions in that summer between your high school senior year and your first year of college. During those orientation sessions, there's going to be presentations from people from the different offices on campus, letting you know what services they offer, where they're located, giving out information. So that can be really helpful just to kind of get an overview of what all is on your campus and where to find it, and being able to put some faces with some of those services. And as Caleb said, even if your campus doesn't have a particular office that you go to that's a hub, if you need a service and you walk into just about any office on campus and walk up to somebody and say, hey, I'm looking for financial aid, or I need to go pay for a parking pass, or whatever it is you might need on your campus, there's somebody that's going to point you in the right direction. They work there. They're there to help you, even if they aren't the person that can help you with that particular thing. They're going to be more than happy to let you know who you need to talk to or where you need to go.
I think this is another one of those times where you can turn to your campus advisor or your academic advisor. Mine has been the best for helping me get connected with resources on campus too. Basically any question I have, even if she doesn't know the answer, she can tell me where to look on the website or a phone number or where on campus to go to get help with whatever I need.
I think it's also wise to become as familiar as you can with your campus websites. There are a plethora of information and such a great resource. Just about anything that you need to find or need to know, you can find on the website. For instance, a lot of our high school seniors and college freshmen in the state are tapped into our state's Text for Success program that Tana talked about in the last session. And a lot of times, if I'm answering a student's question and I don't know the answer, the very first thing I'm going to do is I'm going to look up where that student is attending college or wants to attend college. And I go and look up the information on the campus website, because that's where that's where it is. So I would suggest becoming incredibly familiar with your campus website and just navigate it and look around for the information that you need. Which I'm going to piggyback on that last question a little bit. Quite often, as we all get a little bit older, and as you all will get older, you're going to hear that phrase, oh, that's a great resume builder. That's going to be a great resume builder. What are you all doing while you're in school to build those resumes so that when it comes time to apply for jobs, and so I know, Caleb, I think you said you're in a job right now, so you've been building that resume. What have you been doing to build that resume while you're in college? What are some of those great resume builders?
I think one thing that I had to learn was, like, they talk about following your passion, and maybe we think it's kind of corny, but I'm kind of a proponent of it, because when you're following something you really care about and it's like really intrinsic to you, it seems like it all just moves organically in the right direction. So I'm very interested in mental health, and I am a veteran, and I might want to work with veterans down the line. And so I did some volunteer work 2 summers ago at an organization in Pennsylvania that does outdoor recreation, like adventure-based therapy for veterans with PTSD, post-traumatic stress disorder. And I love the outdoors and I love mental health. And it was so cool because we would be like rock climbing and hiking and mountain biking. And I've got this love of the outdoors and this love of doing mental health. And it's just, I would be doing that anyway. Like I would do that just for the joy of doing it. And when I put it on my resume, people are like, "Oh, that's awesome! That's amazing." So that's kind of how I would approach it, I guess.
I agree with Caleb. I really think you should figure out what it is you like to do with your life and what you want to do and what you want to accomplish, and find things that resonate with that. Like for me, getting involved and finding an internship that allows me to gain experience at the equine assisted psychotherapy and therapeutic horse riding centers has really helped my resume and my curriculum vitae for grad school as well. It has opened up avenues to not only gaining the experience and the knowledge, but I've also made connections for the professional world when I'm out of school, making connections and establishing a good relationship with people in your desired field of practice are just great for your resume in general. And another thing I wanted to mention was there are various opportunities that West Liberty offers their students for resume workshops. They actually have tutors who will help you, sit down and make a list of everything you've done and your accomplishments, as well as your employment and volunteer opportunities. And they help you pretty much word them or organize them in a more effective way so that, it can be more beneficial for you.
I agree about following your passions too. I had become a Celebrate Recovery leader even before I went back to school. But through that, even before I had gone back to college, it was connecting me with people in the field. And now I volunteered with Harmony House, the city mission, and another program here through a church that helps with the unhoused community. And there, like she was saying, we just made so many connections through all of that, and you gain so much knowledge and get comfortable doing what you'll be doing once you do graduate. And then we also have a resume builder just on the website where you can plug your own information in. And then I believe there's also a resource on campus that you can go and someone will walk through with you and go over how to word things and just help you put that together as well.
Well, thank you guys. I've got one final question for everybody because we're getting close to the end of our time together. We hear all the time, if I only knew then, but if I only knew then what I know now, right? If looking back those first days when you walked on a campus, what do you wish you would have known then? But I want to reframe it a little bit also. What's the one piece of advice that you would give a student walking onto campus for the first time? And it could be a high school student that's transitioning to that first year freshman, or those of you that are already in grad school, the first semester grad student. What's the piece of, if I only knew then what I know now, that one piece of advice you would give the new student?
I just tell them to be confident and be self-aware. Ask for what you want. Ask for any help that you need. Don't be scared to tell someone that you need help, because they're there for your support. They're there to help you succeed in college.
I would say to believe in yourself. Don't doubt yourself. Your dreams are possible, and to stay dedicated.
I would suggest getting involved and taking advantage of everything that college life has to offer. Personally, I was a commuter student all throughout undergrad, and I had the tendency to go to campus, go to my classes, and then go back home. And once I got into my master's program, which was preparing me to work in the student affairs field on a college campus, I saw all the wonderful programs and activities and organizations that students were getting involved in and that I could have been getting involved in during undergrad. And I wish that I had taken advantage and gotten more involved in some of those things to really get, an even richer experience during undergrad. So I would definitely recommend getting involved and building community there on your campus. And also just to be your own advocate. If you notice that you're falling behind in something, or you need help, or there's just something that you could use some assistance with, don't wait to speak up, to reach out to whether it's your academic advisor, your professors, or whomever. Ask for that help that you need, reach out, get tutoring or whatever it is, so that you can have the best possible experience for yourself.
I think I would echo Autumn there on asking for help. And man, I was so hesitant to say I didn't understand something, or I didn't know where to go for something, or I was confused. And I finally kind of just got over that, and I just decided to be the guy that was like, "Hey, professor, I'm not following. Can you back up a little bit and we go over that again?" And that made me so much more relaxed. And the response was always great. They were always like, "Hey, good question." And your classmates will always come up to you afterwards and they're like, "Dude, I was wondering the same thing, but I didn't want to ask." So it's not just in the classroom, it's it's just in your life in general. You know, you're confused about something, nobody's going to fault you for asking. Just be confident, like Autumn said, be your own advocate, and you'll do just fine. You know, college it's very doable. As I look back, there's no one moment where it was like I was on the brink of falling apart. You know, it feels overwhelming if you think about it all at once. But when you reflect on it, you're like, oh, it was just a long series of small steps that puts you in a whole different place in your life. It's awesome.
I'm writing that down, a long series of small steps. I like that. Small steps. So
I like that too. Good one.
I like that. I like that whole bunch. I had to write that down. So Samantha, Autumn, Caleb, Ashley, thank you all very much for being our panelists today. I think it is fair to say that you all are not just surviving college, but you are thriving and excelling. Thank you for sharing your knowledge, your expertise, your experiences, your journey with all of us today that we're here joining us. For those of you that were listening and watching, I hope that the answers and the information that they provided to you today has helped put some of your trepidation aside, and that you are just as excited to start or continue your own journeys with your future plans. With that, Carolyn, I'm going to turn this over to you, and I thank everybody for being here today.
Thank you so much, Heather, and thank you to these panelists. You guys did a great job. I mean, I think we really saved the best for last. That was just a really great panel. I think really informative for the students at different levels, and also for those of us that are not in school. Just lots of good tidbits and wisdom from you all. So thank you all so much. Thank you to all of our panelists, all of the people attending, all of the people already checking this out on the recording page. It's been a great couple of days, and it's been really great to spend it with so many of you all. So I just want to say huge thanks. I also put up on the screen our planning committee. We could not have put this together without our planning committee. A lot of these people are faculty members at behavioral health programs across the state. They are the advisors and the professors that these students were just talking about, the people you can reach out to for more help, for guidance when you're going through your decision-making processes. So these are just great people to reach out to and to take note of. The slides from today are all going to be available. They're already available on the conference website, as well as the recordings. So many links to different opportunities. Please share the recordings with a friend, share the resources with your classmates. This information is here for you all to help you all succeed. And I'm just thinking back now to, our welcome that Mr. Schmidt gave yesterday, and just talking about how many decades he has been working in the behavioral health field, and with all of our panelists, just how much experience has been shared over these last couple of days. And I'm just so excited to see what the next couple of decades hold as the students that receive these materials decide on their education paths, decide on their career paths, and hopefully increase our behavioral health workforce across West Virginia so that more people can receive the care that they really need and deserve. So big thanks to everybody. Hope everyone has a great afternoon, and we'll see you next time.
Thank you so much.